Good afternoon, everyone.
Good afternoon, Madam Chair.
Good afternoon. Thank you for joining the Senate Finance Committee. Today is Thursday, March 6th. It's our last full day of hearings before crossover. We have 7 bills on the list today. I'm going to read the order of the bills, which could change based on availability of our witnesses and our senators. I ask that the sponsors, you have as much time as you need. Witnesses, please keep your testimony to 2 minutes. We're going to start with Senate Bill 726, presented by Senator Ellis as Chief of Staff. And then we're going to have 848, 815, 894, 678, 965, and 985. So thank you for joining us. I'm sorry Senator Ellis isn't well today. This is Natoya Mitchell, and are you bringing the panel up?
Yes.
Is this Matthew Saudry, Zach Frink, and Victoria Clark? Is that who we have?
Yes.
Okay, thank you very much. You can begin when you're ready.
Good afternoon, Chair Bidel, Vice Chair Hayes, and members of the Senate Finance Committee. I'm Natoya Mitchell, here on behalf of Senator Ellis to present on Senate Bill 726. Senate Bill 726 strengthens union bargaining rights in Maryland's cannabis industry by requiring labor peace agreements between employees as well as employers. Similar requirements exist in several states to protect interest in business continuity and revenue stability. Cannabis retail sales in Maryland for fiscal year 2025 are expected to exceed $1.1 billion, with over $100 million in tax revenue. As the cannabis industry continues to grow, Senate Bill 726 will encourage employee and employee workplace bargaining. Additionally, we received several levels of support from the Service Employees International Union, the American Federation of State, County, and Municipal Employees. And for these reasons, I respectfully request a favorable report on Senate Bill 726.
I'd like to go next.
Hello, everyone. Oh, what? All right. Hello, everyone. My name is Victoria Clark, and I am a Maryland cannabis worker who successfully organized my own workplace. I've seen firsthand the lengths employers will go in order to prevent workers from standing together. During our campaign, we faced relentless union busting. Managers spread disinformation, attempted to divide us, and used fear to keep workers from demanding better wages and conditions. Through the help of UFCW Local 27, we were able to win that election in a landslide, but many workers are not that lucky. Since organizing my own workplace, I have connected with cannabis workers across Maryland and Delaware. The difference between the 2 states is staggering. In Delaware, where labor peace agreements protect workers' rights, employees have a real opportunity to organize without fear. But in Maryland, I've seen the worst of the industry's anti-worker tactics, including one employer who nearly fired every worker at their store just to crush a union drive. Maryland cannabis industry is booming, yet the workers making it successful are struggling. We need labor peace agreements to ensure that every cannabis worker can organize without fear of intimidation, retaliation, or being fired for just standing up for their rights. It's time to bring fairness and stability to this industry and give workers the respect they deserve. Thank you.
I'd like to go next.
Good afternoon, Chair Bidel, Vice Chair Hayes, and member of the Finance Committee. My name is Zach Frink, and I'm a union organizer with UFCW Local 27 based in Towson. That's the United Food and Commercial Workers Union. We represent workers in grocery, retail, food, service, healthcare, cannabis, and numerous other industries. I'm here today to express my strong support for SB 726, the Labor Peace Agreements Bill. I wanted to add my experience from the viewpoint of someone who organized their workplace as an employee. While organizing my workplace, we endured intimidation and targeted retaliation. For a lot of workers, those factors make forming a union almost impossible. My workplace was fortunate to overcome those obstacles. The same can't be said for many other places. Intimidation and targeted retaliation happening at scale prevents numerous unions from being formed. That's a significant amount of pay, benefits, and negotiation power that workers lose. The passage of this bill can help prevent workers from losing what they always should have had in the first place. Labor peace agreements empower workers to organize without the fear of punishment or losing their job. And LPA ensures the company stays neutral and goes straight to the bargaining table. I strongly urge you to support this bill so workers can have another tool to negotiate a fair contract at their jobs. Thank you.
Thank you. And then finally, one last.
Good afternoon, Chair and Vice Chair and members of the Finance Committee. My name is Matt Sondry. I'm a resident of the District 15 and a cannabis worker, and I'm here to testify on behalf of UFCW Local 400 in favor of the Senate Bill 726. I'd like to thank Senator Ellis for his leadership on this issue. As a cannabis worker and a union member myself, I've experienced firsthand all the barriers that can get in the way of organizing a union. It can take an incredibly long time between voting to unionize and actually negotiating a contract. The store that I currently work at organized our union last year and voted to unionize in September. And it's now March of the next year, and the company still refuses to meet us at the bargaining table. Organizing the union in the first place was already a challenge in education, since all my coworkers didn't even know what a union was. I feel like these things should be accessible. In my experience with the busting attempts at my store, and with all the negotiations in our company, I have come to reason that they will take all that they can get from us, not because they're malicious, but instead because it's simply good business. That's why we need these laws and protections in place. Thank you.
Thank you for your testimony. Do I have any questions for this panel? None at all. Natoya, you did a really great job. We'll make sure Senator Ellis knows you did good.
Thank you, Madam Chair.
Thank you. Senator Gazone, you are next. Senate Bill 848.
We are ready for you.
Public Health Abortion Grant Program. This is joint with B&T. Senator Gazone has a panel. Robin Elliott, Brooke Learman, Felicia Porter, Karen Nelson, Jakaya Johnson, and Lynn McCann. Yay, Lynn McCann.
Oh, you need me
yay.
up there?
Okay.
We might have, okay, that's good, Senator. That's great.
I feel like I'm in JPR.
Why? This
I
is
hope we
not
don't get the same kind of
JPR.
questions.
This is the Finance Committee. Thank you.
Thank goodness. Good afternoon. Thank you, Madam Chair. You have seen this bill before. It came to you last year, almost in the exact same format. And I'll get into that in a minute. Look, it's probably pretty unusual for you to see me here on an abortion bill, and because I'm just a numbers guy. I just do budget. But this is about money. And so I was interested in it. I was interested in the fact that it's about some money that's sort of locked up right now. There are clearly folks who are in this room who support abortion care and those who are opposed to it. And I get that and I respect it, but I support it. And because I support it, I don't like to see money left on the table. You may recall the way this bill is set up. There's monies that were put into each of the carriers, insurance carriers. They were collecting over the years, and it's built up combined about $20 million. That money is sitting there in carrier accounts across the state. What this bill does is create a logical way to grab that money, quite frankly, put it into the health department, and use it for grants for abortion care in a way that we do in so many other areas. We do grant programs in all kinds, for all kinds of things in the health department. To me, being able to access this money is reasonable. It's what it was intended for. It's all related to the Affordable Care Act and requirements in that. The previous bill, just to be clear, from last year was, when it came in, there was some special uses for the money other than simply abortion care. There's security issues that it talked about paying for, travel issues. But it was determined and learned that the law is very clear, that these monies are only to be used for abortion care. And so it is for that reason, and the needs that have developed and continue to develop across the state for this, that I have agreed to put this bill forward, and I believe it is dealing with a critical need. We all agreed, we enshrined reproductive freedom in our Constitution, and this is a continuation of that commitment. And with that, Madam Chair, we've got a very knowledgeable panel, much more knowledgeable than me, on these issues for sure. And I will pass it on to them.
Robin, who's going to start?
I can start.
Comptroller, thank you. Thank you for
Thank you. Thank you, Chairman Gazzoni. Thank you, Madam Chair, Mr. Vice Chair. Good afternoon. For the record, my name is Brooke Learman. I have the honor of serving as Maryland's Comptroller, and I'm here today in strong support of SB 848. I also want to thank the sponsor, Chair Gazzoni, for his leadership in bringing this forward. So today you are going to hear compelling testimony from a wide range of advocates, law centers, state agencies, care providers, elected officials, faith communities, and individuals directly impacted by this bill, all of whom are united in their support. But if Chair Gazzoni is the numbers guy, I am here as the numbers gal. And so I am here to underscore one crucial point about this bill. It will not require any additional funding from the state and will actually buoy the bottom line of often struggling reproductive care providers. Simply put, we are putting money that is sitting unused in bank accounts to the work of doing for what it was supposed to do. Nearly 15 years ago, when the Affordable Care Act was enacted, it mandated that insurers collect a $1 per month premium from Marylanders, which is then placed in a special fund designated exclusively for abortion care. The truth is, the true cost of abortion care coverage is mere pennies on the dollar, leaving a significant portion of these funds untouched. Since the Affordable Care Act's passage, roughly $25 million has been collected and sequestered, and this fund continues to grow by approximately $3 million annually. So SB 848 is a practical, effective solution to ensure that these funds are used for their intended purpose, supporting equitable access to abortion care in Maryland for those who are uninsured or underinsured. By leveraging funds that would otherwise be simply sitting in bank accounts across the state of providers, we are making a smart and responsible investment in the health of our residents to ensure these critical services remain available. For these reasons, I urge this committee to issue a favorable report. Thank you.
Thank you. Now who would like to go? Karen? Somebody.
I'm happy to go. Thank you. My name's Karen Nelson. I'm the president and CEO of Planned Parenthood of Maryland, and I respectfully request the committee vote favorably on this piece of legislation. Thank you for hearing from us today. Abortion services really are an essential part of sexual and reproductive health care services, and the majority of Marylanders agree with this sentiment. 3/4 of voters came together and enshrined reproductive rights in our state constitution during the last election. Our community and Maryland voters, they want abortion care available and accessible to patients who need it in the state, and this bill will help make that happen in the ways that have already been described. You know that we are living in a time that presents some very unique obstacles for us who are providing abortion care and for those who are seeking abortion care, and that includes in this state in Maryland. And as the head of Planned Parenthood, I see this intimately every single day as our patients struggle to obtain care. Even in states like Maryland, where abortion is protected, there's still very real issues with accessing care, and especially for the most vulnerable populations. Uncompensated care puts strains on everyone, but especially nonprofit and the small independent private abortion providers. Having this fund would limit that stress on providers, but more importantly, it would provide care to patients. And it does so with 90% of all the money going directly to providers and to grantees. This legislation would make available financial resources to ensure that abortion care that is so needed in this state will be able to continue. And I want to thank you for considering this and urge a favorable vote, because this is really a great opportunity for this state to continue to show leadership in reproductive health care. So thank you for listening today.
Thank you, Karen. Who would like to go next?
Good afternoon. I'm Madam Chair, Mr. Vice Chair, members of the committee. My name is Jakia Johnson, and I am the Executive Director of Reproductive Justice Maryland. And we believe that this program is a significant step towards addressing disparities in reproductive health care by supporting low-income, uninsured, and underinsured, and otherwise marginalized individuals who might struggle to afford abortion care. So as I'm sure you all are aware, following the Dobbs decision, Maryland has become a critical access state for abortion care in our region. And we've seen an increase in patients seeking services, which has increased the need for sustainable funding to support equitable access to care. This bill will ensure that Maryland remains a national leader in reproductive freedom by directing existing funds towards services that people desperately need. So if you haven't heard it enough, the bill is fiscally responsible. It does not rely on general state funds, but redirects money that's already collected for abortion coverage to improve access to care. And it ensures confidentiality protections for patients and providers, making sure that those who offer abortion or seek abortion are safe from legal or political threats. The right to abortion is meaningless without access, and financial barriers and logistical challenges continue to prevent Marylanders from receiving the care they need. This bill takes concrete steps to remove those barriers and ensure that abortion remains safe, legal, and accessible for all, regardless of their income or insurance status. For those reasons, I urge the committee to vote favorably on Senate Bill 848 to affirm Maryland's commitment to reproductive freedom and health equity. Thank you.
Councilwoman Porter.
Thank you so much, Chair Bidle. For the record, Chair Bidle, Vice Chair Hayes, and members of the committee, my name is Councilwoman Felicia Porter, representing Baltimore City's 10th District and Chair of the city's Public Health and Environment Committee. As a public health scientist for over 15 years, I am here to express my strong support of Senate Bill 848, which affirms that abortion care is health care and, most importantly, does not discriminate based on state residency, insurance coverage, immigration status, and more. With the public's decision to enshrine the right to abortion in the state constitution, this bill will establish a groundbreaking, first-of-its-kind program to ensure meaningful access to that right. Access to abortion care in Maryland is increasingly at risk due to the unstable national landscape and overwhelming strain on the healthcare system, and disproportionately impacting Black and brown women, young women, and uninsured individuals. These communities already face systemic barriers to maternal health care, and the closure of abortion funds multiple days a week due to insufficient funding only exacerbates these challenges. Despite the urgent need, there are currently no state-level public health grant programs dedicated to sustaining abortion care, a direct consequence of the Hyde Amendment, which has prohibited federal funding for these services. Senate Bill 848 seeks to address the disparities by creating sustainable, dedicated source of funding for abortion care without using taxpayer dollars. Instead, it will be financed through a surplus of insurance premiums, as mentioned by several members of this panel. With fewer than 5 abortion providers in Baltimore, access to care remains a significant challenge. Recognizing the need to protect reproductive rights, 86.4% of Baltimore City voters supported question 1, demonstrating the overwhelming public support for abortion access. By prioritizing funding specifically for abortion services, this legislation serves as a critical step in our state's commitment to enshrined abortion rights, uplifting those most impacted in systemic inequities, and also strengthens maternal health outcomes for marginalized communities in urban cores like Baltimore City and the 10th District for where I serve. And so I strongly urge a favorable passage of this vital health-geared legislation. Thank you.
Thank you. Robin Elliott or Lynn?
I can go next. Hello, my name is Lynn McCanya. I'm the co-executive director of the Baltimore Abortion Fund, a state-based nonprofit that provides Maryland residents and those traveling to Maryland for care with logistical and financial support. I was here around this time last year testifying in support of this legislation. I wish that I had come back today with better news, but unfortunately I'm here to report that things have gotten worse. Requests for assistance to our organization have continued to skyrocket. That surge includes both Maryland residents, who make up about 2/3 of those we serve, in addition to those traveling from out of state. Our organization simply does not have enough resources to keep up with this demand, not even in collaboration with other partners across the state. We estimate that we would need about at least $6 to $7 million to meet the current level of demand. Our organization's annual budget is about $2 million. Because funding is so limited, our organization has to operate with a fixed budget in order to make sure that assistance is available year-round. That budget used to reset monthly. We're now operating week to week, and sometimes funds are exhausted within the first 24 to 48 hours, leaving hundreds of Maryland residents and patients with few, if any, alternatives. We've had to turn away more people last year than we ever had before, and even folks who do get support from BAF are getting just a fraction of what they need overall. We have patients and clients sitting in waiting rooms across the state, hoping at the 11th hour that BAF or someone will step in and close their funding gap. Our case managers have to tell them, I'm sorry, we're out of funds. There's nothing that we can do for you. The best that we can do is give you a ride home or put you on a plane. And they go home, and we know that they remain pregnant. And especially for later care clients whose care is time sensitive, that might mean that they are forced to remain pregnant and carry to term against their will. And every time that this happens, it is sickening, because we know that it does not have to be like this. This grant program has the potential to be transformative, direct, and meaningful for patients and residents across the state. It's an opportunity to put our values into action, and we urge the committee to have a favorable report on this legislation. Thank you so much.
Thank you, Lynn. And Robin?
Good afternoon. Robin Elliott. I'm here today on behalf of the Women's Law Center of Maryland, and just wanted to tell a little bit of the origin story of this bill. So back in 2022, this body, in anticipation of the Dobbs decision, passed the Abortion Care Access Act. In that bill, it had a requirement that the Maryland Insurance Administration collect the information about how much funding was left in these segregated funds that you all have heard about today. When those reports started coming in, there were numbers of around, as Senator Gazzoni said, $19 million, that is before interest, between 2014 and 2023. Those funds cannot be used for anything else other than abortion care services, direct services. That is in the federal law. As we've heard today from this panel, we are facing a public health crisis in reproductive health care. We have a very tumultuous landscape, and we have a healthcare system in distress. So what this bill does is it takes a classic public health solution approach in saying we need grant funds to fund services for people who are uninsured, underinsured, or who cannot use their insurance because they are afraid of the confidentiality issues. So with that, would very much appreciate a favorable report and happy to answer any questions.
Thank you. Senator Gall has a question.
Yeah, thank you, Madam Chair. Thank you, everyone, for your testimony. Robin, maybe, I think you may help me a little bit understand. So I get the need, completely supportive of, the need for this. I'm just trying to understand how the mechanics of this works. So who currently holds this money in an account, maybe like an escrow account or something similar that's set up with the insurance carriers? Is that right?
That's correct. So the insurance carriers are required to put any abortion premiums that they collect into these segregated accounts. So the account is held by the carrier, but they are not allowed to use the money for anything other than covering abortion care. As the comptroller said, the charge for abortion premiums, because it's set in federal law, far exceeds what it actually costs to cover. So the carriers aren't using most of that money. They are covering abortion care, but they are, because of federal law, collecting far more than is really required. So the money's sitting there. So what the bill does mechanically is that the insurance commissioner takes a look, figures out how much money there is in excess, issues an order for 90% of the surplus funds, leaving some for any kind of outstanding claims, and moves that money to a special fund under the Department of Health. And then the Department of Health does its public health grant work. So that's how the process will happen under this bill.
Okay. And is there anything, I think, so this originated from the Affordable Care Act. Is there anything there in federal law defining, I guess, maybe abortion care or restricting how these funds are used? And maybe, so, I understand what we want to use these funds for, but is there anything defining how they're supposed to be used?
Yes. Okay. The federal law is extremely clear that these funds can only be used for abortion services for which no federal funds can be used. So under the Hyde Amendment, there can be federal funds used for abortions in the case of rape, incest, or life endangerment. All other abortions, no federal funds can be used. So the federal law says these funds can only be used for direct clinical services for which federal funds would be prohibited.
Okay. And so, it's obviously because of the bill, it's a position that even security, that would fall under abortion services. You're nodding your head.
We tried last year.
That's right. That
You might remember we tried very hard to see if there was some flexibility. Obviously, funding services is incredibly important, but there are some other needs on the reproductive health landscape. You all heard a wonderful bill and passed a wonderful bill on the need for security. We learned through this process that it was crystal clear it had to be for direct services.
Gotcha. Okay. And I was looking at, there was a letter that was submitted by the League of our friend Matt Celentano, who disappeared, but he mentions, I know it's an informational letter. I don't know if maybe you could help me understand. He mentioned something in there about some concerns about, I know it's an informational letter, concerns about being a taking. Did you have an opportunity to look at that, Robin?
I did, and that issue came up last year, and then Senator Ariana Kelly, who was the bill sponsor, asked for an advice of counsel from the Attorney General. And before she left office, she gave me permission to share this. And so the Attorney General looked at this issue last year, and it's a long letter, but I'll kind of cut to the end, and I'm happy to share this with the committee. And it says that these facts would support an argument that qualified health plans, these are the insurance plans with these funds, do not have a vested ownership interest in such, funds at this time, as there is no evidence that qualified health plans have title to the present or future enjoyment of the funds, and thus they would likely not be able to succeed in a takings claim.
Okay. Okay, thank you. And just real quick, one last question, Madam Chair. So the grant process, can you just tell me a little bit about how that would actually work? Like, how do these providers, how is it being envisioned that would work, that they apply for, they are able to get it? How is that, the mechanics of that going to work?
Sure, and I believe the Department of Health is coming up on the second panel.
Well, maybe we can.
But just to let you know, what the bill does is it creates a framework to allow the department to do its public health work and ensure that the funds are going to both directly abortion providers in some cases and abortion funds in other cases to make sure that we have equitable access to abortion care across the country. So you will be hearing from the department, and it provides for flexibility because we know the needs are going to change. And so we want to make sure that the program is nimble to be able to meet those needs.
Okay, thank you, Robin. Thank you, Madam Chair.
You're welcome. Senator Mounts, you have a question?
Thank you, Madam Chair. And I have a question for Robin. With these funds, this fund that's being created doesn't currently exist. So it'll be created if the legislation is enacted. And that would come from carriers on the Maryland Exchange, correct?
Correct.
And then, so carriers on other exchanges, if funds aren't existing in other states, they would not be able to transfer funds into the Maryland fund, right?
Yes, this bill does not affect any insurers that are outside of Maryland's regulatory control. So the way our statute is set up, this would only apply to those carriers that sell insurance on our Maryland Health Benefit Exchange.
Okay. And then, so my other question kind of follows that track. So if it's Maryland only, how is it, I think I heard the testimony that citizens who are not residents of Maryland are eligible to benefit from this fund. Is there any limitation on who is eligible?
No, there is no limitation on who is eligible. And the federal law is not specific to state residents, so it does allow flexibility. In putting together this bill and working with the bill sponsors, was very clear that our healthcare system is in distress for many reasons. Some of there are more people coming from out of state for care. But the idea behind allowing for flexibility is to ensure our providers are sustainable and that they can sustain services in Maryland.
Yeah, but doesn't that flexibility, isn't that the drain that was referenced? It was testified that was the drain. It's a Maryland-specific program, so I don't think there's an interstate commerce issue raised by. Would it be the discretion of the state of Maryland to decide whether someone who is not a Maryland? It's a better way to put the question. I apologize. I always do that. I start talking before I start thinking. So is it a better way? Is it the discretion of the state of Maryland to determine who can be eligible? Do we have the discretion to say this is only a fund that will benefit Maryland residents? Or better yet, not everybody's on the exchange, but I guess it would be Maryland resident.
Yeah, you do have that discretion in the legislation to do that. The reason that that is not a part of this bill is to ensure that the health department has the maximum flexibility to be able to make sure our providers can sustain themselves. There are providers who are located in rural areas on sort of the border states that do see a lot of out-of-state patients. Those providers are in financial trouble. So we want to make sure that the health department has all the flexibility they need so that our providers can stay open. And we want our providers to stay open so that Maryland residents continue to have access to care.
But you heard the testimony that so many people are coming from out of state that it's draining. That, I didn't hear that. Did I hear that incorrectly?
No, you heard definitely that there are more people coming from out of state. There are also a lot of people in Maryland. Maryland has wonderful laws, in part to the, of course, the Maryland General Assembly. Abortion coverage is required in Maryland. But the way the insurance law works, as you all deal with every day, day in and day out, is that only affects about a third of Marylanders who are covered.
And do we know how many people are coming from out of state?
So we don't know that number exactly, but since the Dobbs decision, we've seen an increase of about 20%. It fluctuates. There are states like New Mexico, if we think of where New Mexico is situated, that have seen increases of 250% because they're surrounded by states that, more states that have restrictions. So definitely the states that still preserve abortion rights and abortion access are seeing people coming from out of state. That's not the only reason why abortion providers are in sort of distress. This is a really unusual landscape, how quickly it's changing. Every day there's laws that are passed that are then blocked in court, that change day to day. It is a very, very unusual time for providers. So it's not just the out-of-state people coming in, it's our entire landscape. So this bill is really intended to shore up our safety net provider community, who are healthcare providers, to ensure they are remaining open for Marylanders.
Yeah, and so along those lines, it's kind of funny to talk about in-state and out-of-state. I've at one time had constituents that had a mailing address that was in Delaware. In my district, there were voting constituents. They got their mail, was delivered through Delaware. But for tracking this and understanding the costs and things like that, do you think it would be helpful to know, how much is being spent on out-of-state citizens?
So, I mean, there are, the department can collect certain data. They are not allowed in this bill to hold personal information because of some privacy concerns. But I certainly think we will want to look at the number of people who are supported in what parts of the state. There are, just to let you know, there are a couple of organizations doing really, really good work. The Guttmacher Institute and the Society for Family Planning, who have been monitoring what has happened very, very closely post-Dobbs, who put out quarterly reports on the volume and the differences and the changes in all the states related to abortion care. So just to let you know, there are sources of information out there that the health department can be using when they make decisions about how to administer the program.
Thank you very much.
Thank you, Senator. I may want to ask Senator Gazzoni some questions. I have the numbers questions. I just want to make sure I understand.
Yeah,
So
sure.
90% of what's in the fund now will be transferred, effective what date?
Effective what?
When will that happen?
Yeah, well, I presume it'll take a little time, but I guess the effective date of the bill is, I forgot that. September 1.
Okay, so I'm listening to how critical this is, so I didn't know if it could happen before that. And then after, if we pass this. Go ahead.
I suppose you could alter that.
If we pass this bill, this is the only year we need to do this. It'll then automatically continue to transfer?
Yes.
Okay, so we won't have to revisit this every year and move money?
Oh, no.
And the fund will continue to grow based on the process that we use?
That's correct.
Okay, thank you, Senator.
Yeah.
Senator Lamb?
Thank you, Madam Chair. A question for the witness panel. I guess I have some recollection of this bill from last year, I guess, and just trying to understand, how's this bill different than last year's, or is it at all different?
Well, I think Senator Gazzoni really highlighted the difference. Last year, the purpose of the grant program was broader than supporting direct abortion care services. It had security grants, and then it had some language that would have allowed the department to determine if there were other innovations needed to protect access. We found out through the bill process that the federal law was strictly interpreted as services only. So that's the main difference. There are naturally a few tidying up of some of the language, but the substantive difference is what the funds can be used for.
What changed in the interpretation of the federal law to narrow this further since last year?
We just learned more. So the federal law remained the same. We had heard from many in the provider community about all the needs out there. There was a lot of discussion about security, and so we were really trying to, I guess, accomplish as much as possible in a single bill, and we learned that we had to be more specific.
So the main difference then really is just kind of the narrowing of the scope to just mostly just clinical, the focus on clinical services. Yes. Okay. I was looking in the bill folder to kind of follow up on my colleague here to my right's question. This letter from the League of Life and Health Insurers of Maryland, and still see that he's not here conveniently, but about referencing the fact that these are unconstitutional takings. And I guess this question is from Ms. Nelson with Planned Parenthood. Do you think it's reasonable for them to argue that money from federal law requires constituents that the federal law requires that constituents pay into that insurance companies aren't spending is really the property of the insurance companies and not, can be used for the greater good? Because that's the argument that they're making, that that the funds that are collected here are really the property of insurance companies, that it shouldn't be, be able to be extracted and applied in this way. But I find that just very hard to believe that we can't necessarily access those funds, and that's a contention of the League of Life.
I mean, we would like to see the purpose used for direct patient care for directly to, you heard from Lynn, you heard from myself, the struggles that our patients have. So that's what we would be arguing for.
Okay.
And just to add to that, I would say the money belongs to the people who funded that account and should be used for their benefit.
Right. Yeah, no, and I agree. And I think this is a good bill, agreed with it last year, I think, and just find it hard to believe that that's the argument that the League is making.
Senator Guile?
Just one quick question. Robin, if we could, you mentioned the AG letter regarding the takings issue. If we could just get a copy, if the committee could just get a copy of that, we would appreciate it.
I will make sure it's in your inbox this afternoon.
Thank you very much, Robin. Thank you, Madam Chair.
Senator, do I have any other questions for this panel? Seeing no questions, we're going to call another panel of favorable. Lori Richards, Christine Crone, Dr. Diane Horvath, and we're going to have one member of this panel virtual, Layla Hauschmand.
Good afternoon. My name is Lori Richards. I'm here on behalf of the Mountain Maryland Alliance for Reproductive Freedom of Garrett and Allegheny counties. To begin, I want to say that it's not true that the citizens of Allegheny and Garrett are staunchly against abortion. A majority of Allegheny voters supported Question 1, the right to reproductive freedom, last November. And the vote in Garrett was quite close, with 46% of people voting in favor. And that's an 83% increase from 20 years ago when Garrett County voted in the abortion referendum. Mountain Maryland has 96,000 residents and over 1,000 square mountainous miles of terrain. It also has one of the highest poverty rates in the state. Allegheny's median household income is 43% below the state average, and Garrett's is 38% below the state average. Until recently, it was an abortion desert, with no accessible healthcare providers within hundreds of miles. Pregnant people were often referred to local crisis pregnancy centers, which are religious organizations. They're not healthcare providers. Then, in 2023, a small independent clinic, the Women's Health Center of Maryland, opened just outside of Cumberland. For the first time, Mountain Marylanders have a clinic offering the full range of factual, compassionate, non-judgmental reproductive health care, including counseling, testing, contraception, and abortion. Because it's rural, there can be real obstacles for people to get to the clinic. But women who previously had no access to reproductive health care now do. The clinic makes reproductive choice a reality for people in Western Maryland. It serves everyone who needs care, wherever they come from, regardless of their financial means, because a woman's financial means should not determine her ability to have reproductive choices. Reproductive choice comes at a cost. Our clinic is supported by donor funding, but it needs a more stable source of funding to reliably provide accessible health care to everyone. And with that, we urge you, on behalf of the Mountain Maryland Alliance for Reproductive Freedom, to return a favorable vote on SB 848. Thank you.
Thank you. And you must be Dr. Diane Horvath?
Yes, thank you. Hi, good afternoon, Madam Chair and members of the committee. My name is Dr. Diane Horvath. I am double board certified in OBGYN and complex family planning, and I'm the co-founder and chief medical officer at Partners in Abortion Care in College Park. We are an independent clinic, which means we are not affiliated with Planned Parenthood or a hospital system. Independent clinics like mine provide 60% of all the abortions in the U.S. and are often located in communities that are medically underserved. My clinic provides safe, compassionate abortion care to hundreds of Marylanders every year. Over 90% of our uninsured and underinsured patients require some kind of financial assistance, and much of this funding comes from organizations like the Baltimore Abortion Fund. Despite a groundswell of support following the Dobbs decision that overturned Roe, donations to abortion funds have decreased precipitously, leaving many abortion seekers without the resources they need in order to access this essential service. During the summer of 2024, one of the largest national abortion funds dramatically and unexpectedly reduced the funding available to patients. This resulted in patients arriving to the clinic with no funding at all, or just not coming to their appointments. Because we believe in the importance of this care, we significantly discounted our fees so that patients could get the abortions they needed. Though this was the right thing to do for our patients at that time, it resulted in a financial crisis for the clinic. Like most abortion clinics, we run on a very tight budget, keeping our costs as low as possible. Notwithstanding, it is expensive to run a medical facility, and by September, we were 1 week away from issuing layoff notices and closing the clinic entirely. Once a clinic closes, the barrier to reentry is massive, and most times that clinic is gone forever. Because of the precarity of the abortion funding landscape, we remain in uncertain financial circumstances despite a greater than ever need for abortion services. This bill will provide much needed stability for patients, funds, and clinics. It will help patients get the care they need and ensure abortion care remains available for future patients. I urge you to return a positive report on this bill.
Thank you, Doctor. We have one more witness. I think it's Dr. Layla Houshmand.
Thank you to the committee. My name is Dr. Layla Houshmand. I live in Rockville, Maryland. I have a PhD in biomedical engineering, and I'm here today in support of SB 848. In May 2021, before the overturning of Roe v. Wade, an abortion saved my life. And you might think that would have been a compassionate process coordinated by my physicians and offered to me, but you'd be wrong. 3 years ago, my husband and I were expecting our first child. Actually 4 years ago. And I knew something was very wrong when I woke up at 8 weeks and 2 days pregnant in severe pain and with vision distortion in one eye. An ophthalmologist told me that pregnancy had caused a stroke in my optic nerve and I could become permanently blind, but that she couldn't do anything for me because I was pregnant. I wasn't willing to risk my vision for my pregnancy. I wanted an abortion, but none of my doctors would help me. Not my ophthalmologist, she sent me home. And not my OB-GYN's office either. The medical assistant who answered my urgent phone call begging for help coordinating an abortion refused to even let me speak with a doctor. And the religious hospital system the practice was affiliated with, the policies would not have allowed me to have an abortion fast enough. So I had to find a clinic on my own for the next day. And that procedure cost me $950, which I can afford, but most people cannot. And I was very lucky because the correct diagnosis was much worse than we knew. I could have died from a viral infection in my eye and brain triggered by the immunosuppression of pregnancy that we didn't know I had until after the abortion. And to make matters worse, pregnancy would have prevented treatment for it. But the delay in abortion care meant that I have lost most of the vision in my right eye despite 5 surgeries on it by the best surgeons in the world. And this didn't need to happen. I enthusiastically support this bill. Simply want you to imagine what it would be like if I did not have the resources and the wherewithal that I have. Most people simply lack the resources that I am so lucky to have. I'm alive because of luck, and everyone deserves better than just luck. Thank you so much. I really urge for a favorable report on this.
Dr. Hushman, thank you for sharing your story. I think it really brings home some of the reasons people have to have abortions. So I really appreciate hearing from you. I do want to read a message from Matt Celentano. I think he's heard his name called out a few times during his hearing. He said, just a heads up, I had to run over to HGO to testify. The League is not, underlined capital letters, not opposed to the abortion fund bill. There are just questions about the legality. If A.G. Brown says it's good to go, fine. We have asked for an opinion letter. It has not been shared. So I just wanted to share that with you. Do I have any other questions for this panel? Senator Reedy.
Thank you, Madam Chair. It picked up on the testimony for you. You talked about with the demand for abortion greater than ever. Everything I've read about what's happening culturally is that particularly young people are having a lot less sexual activity, which many people feel is actually in some ways a problem. I don't know, it's definitely two ways to look at that. So there's less sexual activity. The availability of contraception is, and in most cases, free contraception or very inexpensive contraception is at an all-time high. So where am I missing that we need more abortions?
Well, I should have been more specific and said that the demand in Maryland, particularly for clinics like mine, is at an all-time high. The number of abortions has gone down since the Roe decision, but actually in the recent years it's gone up again. And I think some of that has to do with abortion restrictions. We know that restrictions don't actually decrease the number of abortions. They push abortions out of state. They push people to get mail order pills, self-manage their abortions. But in our clinic, we are seeing more people now than we had when we opened. And so our demand is much greater. And I think you heard from Lynn at Baltimore Abortion Fund that their demand for funding is much greater as well.
Are there, because Maryland does not charge any sort of copay or any, really, insurance has to cover all abortion procedures in Maryland. Now, I know one answer is that's for Marylanders. There could be people coming from out of state. So what was the cost driver for your clinic having so many people that couldn't afford the services? What are they is there additional charges they have to pay to come to your service?
Well, a lot of our patients are uninsured and underinsured. There's also programs within insurance companies, even in Maryland, that do not cover abortion care under certain circumstances. And we find that a lot of our patients unknowingly have signed up for those kinds of plans, and then they don't get the coverage that they need at the point of care.
Okay. Thank you very much.
You're welcome.
Thank you, Senator. I don't see any other questions for this panel. Thank you for your testimony.
Thank you.
Next, we have 3 favorables that were not part of the panel, but Dr. Nilesh Kalyanarama, Ernice Williams, and Sarah Smith.
Good afternoon, Chair Bidle, Vice Chair Hayes, and honorable members of this committee. Ernice Williams testifying on behalf of the Office of the Attorney General's policy position related to this bill. We strongly support Senate Bill 848, which will ensure Marylanders have continued access to abortion care services through this creative solution and the significant funding problem for abortion care providers. You heard a lot of testimony that kind of has detailed the bill, and we don't want to belabor the point, but we just want to reiterate that access to abortion care in Maryland is at risk without a long-term care solution. Although abortion care services have been enshrined in the Constitution, access is still very limited, and this is critical and needed for a safety net for tens of thousands of people in Maryland. And so we urge a favorable report, and if you have any questions, let me know.
Thank you. Dr. Kalyanarama.
Good afternoon, Chair Bidle, Vice Chair Hayes, members of the committee. I'm Dr. Nilesh Kalyanaraman, the Deputy Secretary for Public Health for the Maryland Department of Health, here to testify in support of Senate Bill 848. As you're aware, the department is in support of this bill. I'm not going to reiterate the reasons why, but I wanted to take the opportunity to answer a couple of questions that did come up in some of the prior panels. One, the department's intention, were this bill to pass, is to be able to fund fund clinics, fund healthcare organizations or foundations to be able to reimburse them for these services, because there are very specific criteria on what these dollars could be used for. That's, I would say in this instance, far more constrained than most of our other sources. We do have to do a little bit of design around this to make sure that we're able to provide these funds, but also that we get accounting of exactly what these funds are spent on. But we've talked through some of these scenarios, and we're prepared to do that if this bill does pass. The second piece is that there are no, from the department's standpoint, there are no residency requirements when we fund organizations for who they serve. We are funding these organizations to provide services, and I'm now talking broadly, not just in this instance. We fund those organizations to provide care and services. So the residency question is not one that we would be asking based on how this bill is written. And so with that, I thank you for your time. I'm happy to take any questions and just reiterate our request that this committee provide a favorable report on this bill.
Thank you, Dr. Kaye. Do I have any questions for this panel? I have one question for Ms. Williams from the AG's office. Can you follow up and see about that letter that the insurance carriers requested?
The letter,
Yeah,
yes,
they requested a letter that the AG thought this bill was appropriate or legally sufficient.
Yes, I'll follow up.
You'll follow up. Thank you. Any other questions? Seeing none, thank you very much for your testimony. We have 3 unfavorables: Jonathan Alexander, Laura Bogley, and Christopher Anderson.
Good afternoon, Madam Chair, members of the committee that are here. I'm Laura Bogley, Executive Director of Maryland Right to Life. We oppose this bill that targets poor and underinsured women and their babies for abortion violence. And the abortion industry has done this since its inception. Historically, the abortion industry prescribed contraception for white women and abortion for black women. Still today, 78% of Planned Parenthood facilities are located in minority communities. This bill uses insurance premiums from insured women to abort the children of uninsured women. Many of those uninsured women are non-Maryland residents who are trafficked into the state for late-term abortions that are restricted by other states. The Maryland General Assembly has intentionally created this demand regionally for late-term abortion in Maryland, and now the multi-billion-dollar abortion industry is looking to insurance ratepayers to pick up the tab for these elective abortions, non-medically necessary elective abortions. In 2024, Planned Parenthood reported $2.1 billion in revenues and $700 million in taxpayer funding. In Maryland last year alone, state taxpayers were forced to subsidize corporate abortion by over $33 million. Enough is enough. We have a $3 billion state deficit. Since 2022, Maryland has compelled most insurance companies to fully fund elective abortions. This not only increases health care costs for all, it also infringes on our First Amendment rights of freedom of conscience and free exercise of religion. For these reasons, we urge our unfavorable report, and we ask any legislator that has a financial interest in abortion organizations to abstain from voting on this particular bill. Thank you.
Good afternoon. My name is Christopher Anderson. I'm the chairman of the Maryland Black Republican Council. Good afternoon, Chair and members of the committee. I respectfully urge you to vote unfavorably on SB 0848 for the following reasons. Margaret Sanger, founder of Planned Parenthood, was a racist and eugenist who said, "We do not want the word to get out that we want to exterminate the black population." Still today, almost 80% of Planned Parenthood abortion facilities are located in black and brown neighborhoods and communities. Also, the Center of Disease Control, the CDC, has requested abortion data from each state to access the need for funding abortion services. However, Maryland is one of the only 3 states that does not fully report its abortions data. While the state does submit data on abortions performed under medical or reimbursement purposes, this is the extent of the reporting. According to Medicaid records, as of 2004, Maryland has spent $9.1 million to fund 12,518 abortions. However, without comprehensive reporting, we do not know the true number, and I strongly suggest and state that the rate is significantly higher inside of the Black community. Maternity mortality rates among Black women remain disproportionately high, particularly following an abortion. The long-term effects of abortion can cause severe reproductive health complications, increasing the risk of maternal mortality and infant death for those who later attempt to carry a pregnancy to full term. Furthermore, under the 2022 Abortion Care Access Act, insurance companies are now required to cover the cost of abortions for low-income Black women. This legislation has also allocated $3.5 million in taxpayers' funds to train abortion providers to meet what has been framed as a growing need among this demographic. As a result, many low-income Black women are receiving abortions without further consulting a licensed obstetrician or a true doctor. I have a lot more to say, but I respectfully ask you to vote unfavorably on this bill. It doesn't meet the demands of the CDC, and it really harms Black women altogether. Thank you very much for your time.
Thank you both for your testimony. I don't see any questions. That ends the hearing on Senate Bill 848. Next, we'll have Senate Bill 815, Senator Watson. Senator, is this your panel, Mark Woodward and Christopher Dews, or are they just signed up?
They're my panel.
They're your panel. Okay, please come up with Senator Watson. This is Senate Bill 815, Occupational Licensing and Certification, Criminal History Prohibited Disclosures. Thank you.
Good afternoon, Chair Bidle, Vice Chair Hayes, and colleagues. For the record, Senator Ron Watson from the 23rd District, Prince George's County. I'm here today to present Senate Bill 815. I'm delighted to be the sponsor, which will provide a pathway for those with an arrest or minor nonviolent criminal history to become licensed for occupations under the Department of Labor. This bill would make an important step towards removing barriers to employment for those with past convictions and provide all Marylanders equal access to work with occupational licenses and certifications. In Maryland in 2022, about 25% of civilian workers held jobs that require practitioners to be certified or licensed. However, those with criminal histories often face significant barriers to obtaining these necessary credentials. The existing system disproportionately affects Black people who constitute 71% of the state's prison population, despite making up only 29% of Maryland's overall population. Senate Bill 815, which directly takes on these disparities, would prevent the Maryland Department of Labor in certain professions from requiring applicants to disclose some past criminal acts that are not tied to public safety. After positive discussions with the administration and the Department of Labor, who helped me create an amendment, I'm submitting an amendment with this bill to limit the professions under the Department of Labor that the bill will cover. The following 6 boards: barbers, cosmetologists, electricians, plumbers, heating, ventilation, air conditioning, and refrigeration contractors, as well as home improvement contractors under the Department of Labor, will not require the disclosure of a person's criminal history when applying for a license or certification if 3 years have passed since they were released from prison. In addition, the amendment excludes violent criminals and those convicted of fraud from the bill. This legislation will not create any new costs nor jeopardize public safety. It simply ensures that individuals who've served their sentences are not burdened by unnecessary disclosure requirements that limit their ability to re-enter the workforce. With an emphasis on rehabilitation and economic opportunity, Senate Bill 815 aligns with our state's objectives to lower recidivism and promote self-sustaining economic activity. This initiative is not only fair but also practical. Removing unnecessary disclosure requirements empowers people to move forward with their lives and make meaningful contributions to our community. I ask for a favorable committee report on Senate Bill 815.
Thank you, Senator. And for you, Mark Woodward?
Mark Woodward for the Job Opportunities Task Force in support of Senate Bill 815. First and foremost, I want to thank Senator Watson for sponsoring this bill and doing such an excellent job at presenting it. There's not a whole lot more for me to say, other than we have a problem in this state. Almost or about 1 million people have criminal history in the state of Maryland, which follows them throughout their life unless we are able to get it expunged. It prevents them from entering into professions and to occupations and into jobs. This bill simply focuses on 6 occupations under the Department of Labor and tries to create a pathway so they can become licensed in occupations that would be a stepping stone for low-income, lower-skilled persons. By doing that, it will not only help them, it will add to the workforce and to the tax base. I also want to point out that this is a very different bill than Senate Bill 54 from last session. That bill applied to about a half a dozen state agencies. So we've narrowed it to only the Department of Labor. And as you've heard from Senator Watson, we've narrowed that further to 6 occupations that, in consultation with the Department of Labor, seem to make the most sense to apply it to. Then we eliminated the predetermination process, which generated a lot of opposition to the bill in this committee last year. So for all these reasons, we believe we've tailored the bill, we've focused the bill in a very limited way to make a difference for people moving forward with their lives in this way. We ask for a favorable report, and we'd be happy to answer any questions. Finally, I was asked by Christopher Dews if he couldn't be here to say, me too.
We like that testimony, thank you. Do I have any questions for this panel? No? Thank you very much for your testimony.
Thank you.
That ends the hearing on Senate Bill 815. Next, we have Senator Mary Washington, Senate Bill 894, Office of Social Equity, Community Investment and Repair Fund, Advisory Board of Modifications. And Senator, I think you have a slide presentation.
I do, and
Okay.
Madam Chair, if you could my panel come up as well.
And is your panel Audrey Johnson and
Yes.
Carrington Anderson? Okay, they're marked, one's marked favorable with amendment.
Yeah.
And I know who Audrey is. Hi, Audrey.
Courtney.
And you are?
Courtney Davis.
Courtney, okay, I don't see you here, Courtney, but that's fine, you're the senator's panel, thank you.
There's a keyboard, okay. Oh, great. How about that? Okay. Yeah, great. Okay, thank you. Hello, colleagues. It's Thursday afternoon. This is Senate Bill 894, and I'm offering a PowerPoint just to kind of remind us, what this is about. So just sort of start with, great. Just reminding us about our march towards adult use cannabis, and we've passed a number of acts. We've created some infrastructure in terms of the Maryland Cannabis Administration, and that there is this, sort of multi-tiered approach. Or there's the Cannabis Administration, there was the Alcohol and Tobacco Administration. I think everything's together now, and there's always been the Office of Social Equity. Just to understand the significance, of the potential revenues and the revenues that we're talking about, and for me, the argument why the state should ensure that we create the proper infrastructure on our side around accountability and transparency. So adult use legalization in calendar 24 was $1.1 billion, and that's an increase over 2024. You know that we impose a 9% sales tax on the retail sales, and it's the Office of the Comptroller is the agency that administers the sale and use tax for the sale of adult use cannabis. Just this the third quarter of 2024, the sales tax that were remitted was, $18.2 million. The comptroller has the role of collecting that money and in allocating that. And again, this is all stipulated in our law that we passed. Additionally, that was stipulated was how was the revenue going to be allocated, the tax revenue. And 5%, just to remind us, goes to a cannabis public health fund. 35% goes to the Community Reinvestment and Repair Fund. 5% goes to actual local jurisdictions for the 5% of the sales tax that actually happens in their jurisdictions. And then there's investments in the Cannabis Business Fund, and then the lion's share, or 50% of it, goes to the general fund. Again, just noting that the second highest appropriation out of the tax allocations goes to the Community Reinvestment Fund. The Office of, by code, in law, the Office of Social Equity has played a very significant role. And mostly, we're probably most familiar with the role that it has played in our social equity program, social equity partnerships. But it also has stated or is referenced that it has charged with administering the Community Reinvestment and Repair Fund. And this is just sort of quoting from a report or some guidance from OSE, that it encourages each county and city to establish an advisory committee inclusive of community leaders, et cetera. So it just encourages them to do this. Additionally, there's some reporting, just one sentence or so, about, starting last year, just kind of starting to do some reporting, but again, it's very general. And then there is stipulations just in this one section that talks about that local counties have to adopt a law establishing the purpose. Okay, again, the purpose is not necessarily established. I mean, the uses aren't necessarily established in law. It's just the purpose, okay? And then the fund can be used for community-based initiatives, et cetera. So I remember when we were going through all of that, and it was a lot to get there. We spent a lot of time really reviewing. I am the chair of AELR. I know there was, following the years, just really focused on just getting the program up and running, a lot of details around the licensing, et cetera. But our state law does not yet really establish any meaningful administrative, procedural, or regulatory frameworks for accounting for or managing or distributing the funds, except, the initial analysis of the number of persons incarcerated. So there really are no provisions in guidance. And so what I looked to was how do we handle other funds? So what this bill does is that it clarifies responsibility for guidance and support. It really codifies also the findings and the purposes of the fund, making very clearly that this fund is for the public interest, and it's the result of legislative findings. It also stands up a board, which we have for other funds from the state level, for the state and the Office of Social Equity to get guidance from members of the community. It does look at administrative expenses. I believe we have some negotiating on that, but administrative expenses. And most importantly, because of the nature of these funds, I feel like it's very, very important that we protect the public, but also that there's transparency, and that there should be a lockbox of sorts for these funds. They can't become commingled with other funds. and also that there is a reporting requirement there. I think I'm done. Okay, so that has to do done with that part. So again, clarifying, there are some clarifying amendments. So as can happen when we are drafting bills, there were some amendments that need to be made. You should have those amendments. It was never the intent of the legislation to transfer the actual administration of the tax dollars from the comptroller. The comptroller is the official administrator of the funds. That is the case. So I believe the committee council, has those amendments. So we were never intended to remove the fund from the oversight of the comptroller's office. Again, that was a drafting error. Additionally, we have met with the Maryland Association of Counties, and I understand their concerns. And I do support the committee amending the bill to address county-level concerns as long as it does not undermine the overall purpose of the legislation is for the legislature to establish our responsibility, our reporting, our transparency, and empower the Office of Social Equity, again, not in the denying of funds or anything, but to really support the intended use and support the potential training or technical assistance that our communities may need to really take full advantage of these funds. The original intent is to improve and strengthen the oversight. I'm requiring looking at the funds, which is also required elsewhere. It enhances and requires a public display or reporting requirements, establishing this advisory board so that, the Office of Social Equity and we, as the program grows over time, can get some feedback about how it's going and making sure that the spendings are aligned with the community reinvestment goals, really clarifying fund distribution and county responsibilities. And at the same time, it really maintains local flexibility when ensuring those funds. So I just want to address straight off any kind of concerns or possible different readings. SB 894 does not remove local control. It does nothing in that area. Counties still have full discretion on how they allocate the funds. It is within the legal framework that's already established, so that is not. This is just a kind of building up on it. It ensures that there's transparency and public input. Again, given the natures of the funds, I think it's really important. So we do not dictate how the counties spend their funds, but we believe it should be in law. Some of the findings coming from the Office of Social Equity's survey about how the funds should be completed. It's a clear plan for the money, presents kind of delays. It doesn't cause them. If you have a plan for it, and again, having a plan is not consistent, you still get your funds, but having a plan really requires some transparency. If counties lack a clear structure up front, it really does risk bottlenecks and some challenges. It also, a structured plan also prevents confusion. The nonprofit partnerships really remain intact. It does not say you cannot partner with none. And a 5% administrative cap is reasonable, but again, that's up to the county's discretion. Growing pains are exactly why we need structure now. And so in conclusion, I ask for your favorable report on this legislation. And now I'd like to invite, and during the whole process, I should also say I have met with the comptroller, I have met with the attorney general, I've met with all of the agencies engaged with this, and you see sitting with me is the Office of Social Equity. And so I'd like to invite the executive director and deputy director to speak. Thank you, Madam Chair.
Thank you, Senator Washington. Good afternoon, Chair Bido, Vice Chair Hayes in his absence, and the members of the Senate Finance Committee. My name is Audrey Johnson, and I serve as the Executive Director of the Office of Social Equity. I appreciate the opportunity to speak in support of Senate Bill 894 with a key amendment to ensure that the Community Reinvestment and Repair Fund remains a truly community-driven resource. The Community Reinvestment and Repair Fund was created with the clear purpose to reinvest cannabis tax revenue into the very communities that have been disproportionately impacted by decades of inequitable enforcement. This bill strengthens the structure, transparency, and accountability of the reinvestment process. It ensures that funding decisions remain responsive to community needs, while establishing necessary oversight through the newly proposed Advisory Council. However, flexibility is essential for true restorative justice. That is why I urge the committee to adopt an amendment to remove the prescriptive language in Section B2I, which limits how counties can allocate funds. Impacted communities are best positioned to determine their own needs, and counties must have the ability to partner with them in a way that is intentional, not constrained by rigid directives. Senate Bill 894 also reinforces key safeguards: publicly reviewed distribution plans, annual reporting requirements, and community engagement mandates to maintain accountability while allowing adaptability. Furthermore, aligning the Community Reinvestment and Repair Fund investments with other state funding initiatives ensures maximum impact and address systematic disparities holistically. We stand firmly in support of this bill, vision to strengthen oversight without limiting local decision-making, and I urge the committee to support the bill with the recommended amendment, ensuring that the Community Reinvestment and Repair Fund remains a vehicle for equity and repair. Thank you for your time and consideration. We are happy to answer any questions.
Thank you, Audrey. And next?
Oh, I'm just here for support.
Okay, thank you, thank you.
So we're here to answer any questions.
Do I have any questions on this bill for the senator or Audrey? I don't see any questions. Thank you very much.
Okay, thank you.
That ends the hearing on Senate Bill 815. I'm sorry. Senate Bill 894. Oh, I'm sorry. Carrington? I was looking up. I was up one. Carrington, I'm sorry. I almost missed you. All good. Thank you.
Thank you, Madam Chair, members of the committee. Carrington Anderson with the Maryland Association of Counties, in respectful opposition as drafted on Senate Bill 894. I thank the senator for bringing the bill, and we do understand the intent. Counties do have concerns with the bill as drafted, and I think kind of to where to start is this fund is still really new. Counties are still working on implementing this and are going maybe through some growing pains on how to properly do this. Counties want guidance and have been asking for that. And so I think there is a local process here with accountability with ordinances that counties have. Counties have commissions, and some counties do rely on nonprofits to help administer this program. And so I think the administrative cap, that is a little low as drafted at the 5%. We've gotten feedback on that. And so for the proper oversight and implementation, concerned that that's a little too low. And then the responsibility language in the bill, we do have concerns that that would impact current commissions that counties have. Just think it's a little unclear. And then additionally, there are still some problems that with counties who have received funds are not able to spend that money. I know that's something that counties have been working on with the Office of Social Equity, and those issues still haven't been addressed yet. And so I think just need some more time, and some of these things need to be addressed before we're further having some restrictions here. So it's for those reasons, as drafted, we would respectfully ask for an unfavorable report.
Carrington, was this brought in front of your legislative committee?
It was, Madam Chair.
So this is a decision of that committee?
That's correct, Madam Chair.
Thank you, Carrington. Do I have any other questions for Carrington? Thank you very much. That ends the hearing on 894. We'll now go to Senate Bill 678. Senator Rosapep is here, I think. There he is. This is Electronic Health Networks and Electronic Medical Record Vendors of Nursing Homes, Release of Records Enforcement. So Senator Rosapep, you have William Castelli and Celeste Bruce with you, correct?
Can I present them? Here they
All
are.
right, thank you. You can begin.
Thank you. Thank you, Madam Chair, members of the committee. 2 years ago, we passed a bill to make sure that the electronic medical records relevant to folks who are in nursing homes who have various health problems, obviously, and often end up in the hospital, are available to use through our CRISP system, which is our electronic data system for medical records in the state of Maryland, to be able to get the information to the right people at the right time to help protect people for their health, but also to save everybody money but not having to go to the hospital. Passed the bill with no enforcement mechanism. I thought that the Attorney General's office was going to enforce it. But then it turned out the Attorney General, and you have a statement from the Attorney General's office saying that their office dealing with these issues is unable to do it. So somebody's got to enforce it. So what this bill does is create a private right of action so that those businesses that are approved by our state health organization can get access to the records they need to protect the folks in nursing homes. Happy to answer questions after my panel goes first because they know more than I do. Thanks.
Thank you, Senator.
Thank you, Madam Chair, members of the committee. Bill Castelli on behalf of Real-Time Medical Systems. And as the Senator explained, Real-Time Medical Systems has been hired by CRISP to work with nursing homes. And the program really is a data collection program. So they work with the electronic medical records of the patients. They take a look at those patient records, monitor them. If anything falls outside of normal parameters, then they will immediately contact the nursing home about it. You know, if Mr. Jones's blood pressure is up for 3 days, nothing's been done about it yet, no medication has been prescribed, they do it so that you can get early intervention because that's when the health results are best for these patients because they're very frail. And the whole goal of the program is to keep them out of the hospital. So that's what the program does. And as you heard, it never had an explicit enforcement mechanism, and there are times where this medical record information is being blocked to business associates of the nursing homes, which is what Real-Time Medical Systems is. So the Senator is also providing some amendments to significantly narrow that private cause of action just against the electronic medical record company. And it also specifies that this information's got to be provided immediately. It's basically computers talking to computers and then forwarding that information to those folks. And then Celeste Bruce, who's with me today, is going to talk a little bit about why the private cause of action really is a method of last resort for us. And it's really just to compel compliance with both the state and federal law.
Good afternoon. Thank you, Madam Chairwoman, members of the panel. My name is Celeste Bruce. I am also here on behalf of Real-Time Medical Systems. None of us really thought we would have to be here to actually come in and argue about whether or not healthcare providers could get access to patients' electronic health records. Interoperability was supposed to be something that everyone embraced. That was, something that was brought in through the Cures Act, and that's been around, as we all know, for some time now. And we are still facing information blocking. When the Maryland statute was passed, I don't know that anyone thought that, again, that there would be roadblocks to achieving interoperability and access to patient medical records. They don't belong to the platform, the health vendor who hosts these medical records. They remain in the ownership of the patient. And so what we are finding is there are now obstacles being placed to access to these medical records, in which case it is affecting not only the CRISP program, but it is also affecting patient outcomes within the skilled nursing facilities. There have been some concerns raised about whether or not the Cures Act provides for enforcement of electronic healthcare medical records blocking. It does not. There is no private cause of action in a federal statute that would give folks the ability to address this outside of a regulatory body, which the feds have a regulatory body. However, it is not doing any enforcement. And so there is no enforcement that is happening when you have blocking of electronic health records, such as we are in Maryland. So what is needed is some mechanism, some narrowly tailored mechanism that will allow for business associates, which are then covered under HIPAA, so there are no security concerns, to be able to access this information. So we would encourage this panel to go ahead and pass these amendments. Thank you. Thank you for your time.
Thank you. I see some questions. Senator Lamb.
Thank you, Madam Chair. Thank you. And familiar with this bill when it came up last year. Different bill, of course. This is kind of adding to what was introduced and passed last year by this body. You know, and I'm just looking through the bill folder at some of this unfavorable, and I see that some of the folks will be coming up, I think, in a few minutes, but trying to address some of these things that seemingly have come up from those who are unfavorable. There's, I guess, a contention here that it conflicts with like federal law.
It does not.
It doesn't.
There is no so the federal law has no private enforcement action. The federal law is concerned with interoperability, as is Maryland. There is no conflict. There is no preemption. Where you have no private cause of action under the federal law, you can't have conflict. The laws themselves, what Maryland passed in 2023, is not in conflict with the federal law either. Both require the sharing of this information, both require interoperability. So we have looked at the question of preemption, we have looked at the question of conflict, and there is none.
Mm-hmm. What do you respond to when they believe that this will generate frivolous lawsuits?
So I don't think that protecting patients in skilled nursing facilities is frivolous. And again, it's a lawsuit just like any other private cause of action. You have to have actual damages. You have to have parties in the state of Maryland. You have to have a basis for which you bring your claim. We're not doing away with 200 years of common law by passing the statute saying that you can just bring an action and not have any damages or not have a basis for your cause of action. We're still constrained and required to comply with the rules of court and with common law. And so here what we have is a very narrowly tailored amendment to a statute that allows for the enforcement of what this body passed in 2023. Without it, who's to enforce it? I mean, you have to ask yourself a question. You've passed a statute, now what? Now and folks aren't just complying because you passed the statute. So in the face of that, we need an enforcement mechanism.
Yeah, and to put another point on that, there have been over 1,000 complaints filed with what would have been the administrative process in the federal government. There is no public information not only showing that they've actually acted on the in any kind of enforcement way on those complaints. It's not even clear that there has been investigations to any of those complaints. So that's the problem, is that while there's an administrative agency theoretically charged with that, nothing's happening.
So there have been over 1,000 complaints filed, but seemingly no follow-up.
Correct. And the committee that oversees that federal program, actually Senator Cassidy, who's now chair of that committee, sent a letter last summer to the body, to ONC, the Office of National Coordinator, and asked what actions had been taken in the face of all these complaints of information blocking. And when you think about it, you would actually have to know where to go to file a complaint. And there were actually over 1,000 individuals or entities that filed a complaint. He did not get a response. Senator Cassidy did not get a response until sometime in January, and no one has made that public. So what we have seen, absolutely zero enforcement being posted on the committee's website, ONC. No one has come out and said there's been any enforcement or investigation into these complaints.
So the Office of National Coordinator for Health IT responded back to Senator Cassidy of Louisiana, but there's nothing that's not been made public?
No, sir. And trust me, we're looking. We're trying to get our hands on what it is the response was, and our fear is that the response back to the committee was they've done nothing. Senator Cassidy was very adamant that enforcement, some type of enforcement or investigation start to take place, and our fear is that the response back is that there has been none, which is why it's not been made public.
So, I guess in the interim, since it seems like the enforcement piece is missing here, I presume other states have looked at passing legislation in this regard, right? Because I think there's a contention that no other states have done this.
There is a contention that no other state has done this, and so you have to step back and take a look at the statutory rubric within each state. But for instance, California has enacted the California Data Exchange, and it requires access to patient records, specifically electronic patient records, and it has a very robust requirements that platforms have to engage in. They have to exchange this healthcare information. There are very robust information blocking regulations around how this information is to be exchanged. And then California also has requirements for not only disclosure, but penalties for failure to disclose. And so what you have there is you have a very robust statutory and regulatory framework around the sharing of electronic health information. To be sure, Senator, there are other states that have penalties and/or mechanisms around the sharing of patient healthcare information. They are some more, some less robust. They come with some penalties, maybe a fine is imposed. In other instances, if there are, you can suffer failures to participate in certain programs that the state has, such as Medicaid. And so it's not a one size fits all. What we're trying to address here is that Maryland has this CRISP program, which is very on the cutting edge. It's great. It's wonderful. It helps our Maryland residents, and yet, if there's information blocking, the program doesn't get its information from, that are from these skilled nursing facilities in order to benefit patients.
And I guess last question here then, with you mentioned the enforcement piece, and I think what the opponents might say is that the enforcement piece is that there's an enforcement mechanism within the Cures Act, the Federal Cures Act. But it sounds as though Senator Cassidy was trying to go down that route with enforcement, seemingly getting nowhere with the Federal Office of the National Coordinator for Health IT. And so your contention is that that enforcement mechanism is essentially ineffective and we're not there. And so this bill would create a private right of action for entities to be able to sue to have corrective action, I guess.
Correct. Entities in Maryland. So again, I know one of the criticisms is, oh, well, anyone could bring a lawsuit, and that's just not the case. Again, if you're not in Maryland, if you don't have a connection to Maryland, you're not going to be able to be in Louisiana and bring a lawsuit in Maryland because something happened in Louisiana, obviously. Bless you, Senator. So what we have is we need an ability for Maryland residents to protect them in order to get this information back to the skilled nursing facilities without there being some type of blocking.
Right. Yeah, I mean, I think from a standpoint of just ensuring better healthcare and health outcomes, the sharing of data is important. So I appreciate bringing this bill forward. Thank you.
Thank you, Senator. Next we'll have Senator Guile.
Thank you, Madam Chair. I guess help me to understand, because I see that there's a private right of action, and then there's a component of the bill that the Office of the Attorney General is enforcing. So there's two parts of enforcement. Who's enforcing which?
So there is a sponsor amendment that would remove the Attorney General. The Attorney General expressed concern about how they are funded currently to do Medicaid, Medicare enforcement, and whether they actually have the capacity and resources to do that. So the amendment would actually remove the AG as an enforcement mechanism in the bill and would just focus it on a even more narrow private right of action.
Okay. And then, and this is for an individual, right? Or are we talking, who's the person that's bringing the lawsuit?
In
Who's
this
being
case, it
authorized?
could be a company like Real Time Medical Systems that we represent.
Okay.
It could be CRISP. It could be the Health Information Exchange. It could be the patient. It could be anyone who is subject to the requirements of or subject to the statute as it is written. And this is about sharing the electronic health information. So any business associate of a skilled nursing facility. So facilities enter into any number of agreements with outside vendors to provide health care to their residents, and it would cover those.
Okay. And it's my understanding that the proponents and the opponents have already been involved in litigation regarding this issue or similar. Would this bill sort of, I mean, I understand that maybe if there's ongoing litigation, that you may not be able to get into the details of the substance of that litigation, but is this something that authorizes you to do, like a theory of liability that you haven't been able already to do by the existing litigation?
No, so the existing litigation is around anti-competitive behavior. And so what the existing litigation in federal court is regarding is information blocking by a electronic health records vendor's platform that is competitive to real-time medical systems. And in that lawsuit, the underpinning theory is around anti-competitive behavior. The information blocking was simply the mechanism by which the anti-competitive behavior was being performed. Here, this statute doesn't require anti-competitive behavior. So if you think about it, we had to have either antitrust or wrongful tying, that kind of claim, in order to get into court on a cause of action. This would allow anyone who was blocking, you don't have to prove that the other company was trying to compete with you unlawfully. So in other words, it allows us to protect the skilled nursing facilities and their business associates without coming up with a creative underlying cause of action. And in that case, we simply had an anti-competitive behavior.
What was the outcome of that litigation? Is that still ongoing?
So Judge Zinnes issued a preliminary injunction blocking the information blocking. So she stopped the information blocking. It went up to the Fourth Circuit. It's on appeal in the Fourth Circuit.
What was the outcome in the district court?
She issued a preliminary injunction.
Oh, so then the preliminary injunction was appealed?
Yeah, it's an immediately appealable order to the Fourth Circuit.
It's an interlocutory appeal.
Immediately appealable,
Okay.
and so we're just sitting and waiting.
Okay, so there hasn't been any ruling yet on the substance or the merit of the claims. There's only been the preliminary injunction. Is that right?
Well, she issued a 17-page opinion.
Sure, but it's a preliminary injunction.
It is.
I'm just asking, there hasn't been any ruling yet on the merits of the claim, right? I think Bill's shaking his head no.
Yeah,
But there hasn't been. So it's fine. There obviously hasn't because it's on appeal. The preliminary injunction
There's no
is on
final
appeal.
determination from the
Right.
Fourth Circuit. And the Fourth
Okay.
Circuit could choose to do nothing and sit back, and then the case would still move forward. Right.
Okay. All right. I just kind of wonder whether or not what you're seeking for us to do is something that helps to sort of circumvent what's already ongoing with existing litigation. That's the concerns I may have about this.
Sure. And this, so as I'm sure all of you are aware, it's not retroactive. I can't go back and look at past behavior and apply it to a statute that's enacted in the future, right? So it's not to bolster the underlying litigation. What we saw as a result of these actions in this lawsuit and in this arena is that there is a need for an enforcement mechanism in a statute that Maryland passed that doesn't have one. And so that's why we came forward with this, because, again, we don't see this, and neither does the federal government. As the ONC, the Office of the ONC has acknowledged, there is going to be more information blocking into the future because what these electronic health vendor platforms have determined and have figured out is they can monetize patients' healthcare data. And by so monetizing, they can protect themselves against competition by blocking access to the information. That's where we saw a need for the ability to be able to continue to exchange this information between healthcare providers in this setting.
Okay, thank you. Thank you very much. Thank you, Madam Chair.
Senator Mounts.
Thank you, Madam Chair. I'll try to be quick with my questions. For Bill, is Maryland unique, or is this a problem in other states? And so when the patients go from the nursing home to the hospital, how do they get their records?
Well, so the electronic medical record would be available to any institution, so like an emergency room as well. But the whole purpose of this program, the whole purpose of the hiring of real-time medical systems is to keep these patients out of emergency rooms. And so how that happens is early intervention. And if there is restricted access to information, if these two computers can't talk to each other and they don't get real-time data on that patient, and now it's 3 days later that they're getting the information, and Mr. Smith hasn't had a bowel movement in 3 days and now is septic and is going to an emergency room. That's the whole, this program doesn't work. It doesn't help patient care if that information isn't shared like any computer system, just immediately, just.
It's interesting. I had a friend who was recently in a facility, and then their relatives had called me because their blood pressure had dropped down. They didn't know what to do. And of course, I said, get a hold of your doctor right away. But, you know, as far as the damages or the enforcement, is injunctive relief not enough? Injunctive relief with attorney's fees, is that not enough? Why are damages necessary?
Honestly, I think injunctive relief would be certainly the primary, because what the intent of the bill is to ensure that this information is being shared as quickly as possible so that patients' care improves. And I think that is the primary focus of the bill. So I think we'd certainly be open to that.
Thank you.
Thank you, Senator.
Madam Chair, could I make a brief comment?
Absolutely.
Wrap this up. I followed all the legal discussion and all the technical discussion. I want to bring it back a little bit to the policy. We passed policy decades ago to promote electronic medical records as a real important strategy in improving people's health. CRISP is a beacon in the country for how to do it. This is frustrating CRISP's responsibilities. And we passed a bill 2 years ago which said we want to make sure these records are available in real time to protect the patients. And all that's going on right now is there's some folks who are not obeying our law. And so if we make some changes in the bill, open to that. The key thing is these guys got to start obeying the law that we passed. Thank you, Madam Chair.
Thank you, Senator. I don't see any other questions. Thank you very much for your testimony.
Thank you.
That ends the hearing on Senate. No, it does not. I have 2 unfavorables. I'm hurrying. Luke Pinton and Steve Holt unfavorable. Thank you both.
Hello, Madam Chair, members of the committee. Luke Pinton, a Funkabone here on behalf of Point Click Care. In opposition to Senate Bill 678. To my left rather, is Steve Holt, VP of Government Affairs for Point Click Care, the leading technology partner and electronic health record vendor for skilled nursing facilities in Maryland and nationally. Before passing it to Steve, I just wanted to share a few points on the language of the bill, just very briefly. You've heard a lot of testimony already. As you've heard, it relates to House Bill 648 of 2023, which very specifically did not call for private enforcement of its provisions. And this bill, as introduced, as we've heard, establishes a very broad right of action permitting any person, whether directly or indirectly connected to a violating party, to sue. In so doing, establishes a vague, indirect right of action, which is not elsewhere found or currently elsewhere found in the Health General article. And so happy to stand for any questions, but with that, I think I would like to pass it to Steve, who can share a little bit more expertise on this topic.
Great. Thank you, Luke. Good afternoon, Chair Beadle, Vice Chair Hayes, members of the committee. Thank you for the opportunity to be here and your commitment to long-term care and building a sustainable policy environment here in Maryland. I'm Steve Holt, Vice President of Government Affairs with Point Click Care, and here to oppose Senate Bill 678. Like Luke mentioned briefly, Point Click Care is the leading technology partner to senior care providers, providing the clinical infrastructure so that their care teams can deliver the best care possible for the most vulnerable of patients. We also work closely with health systems in the state of Maryland, like UMS and St. Agnes, ensuring patient data follows the patient wherever they are in their care journey so their care teams can deliver informed care at the bedside. Now, as you've heard already, the sole reason this legislation is being proposed is because of a vendor dispute between 2 entities that is currently being litigated in federal court. The original legislation did not have a private right of action and should not, because health information exchange is regulated federally by the Cures Act. This proposed legislation is an attempt to create a conflicting private right of action that is unnecessary and does in fact conflict with federal and state law. Also, the prior legislation never had its rules promulgated. So while we're talking about how data should be shared, we've never been informed by the relative agency to tell us how that should be done. The exact text of the proposed language is equally concerning. Specifically, it states entities may bring an action whether the person interacted directly or indirectly, like Lude shared, key point indirectly, with any other entity. To be clear, that lawsuit can be brought, again, because of the indirectly, without alleging specific harm and without specific connections to the state of Maryland. Also, there is no mention of the patient anywhere in there. As you can imagine, this will require all HIT developers to defend themselves against those frivolous lawsuits, leading to higher costs with zero value for patients. Last, the text would undoubtedly lead to significant patient privacy and security concerns and lacks any protections for patients or their access to care that the Cures Act provides. This is why we are opposed to this legislation, especially since it's been shown that other remedies exist.
Senator Lamb?
Thank you, Madam Chair. I think you referenced the fact that other remedies exist, and I also want to end or I guess begin on where Senator Rosepep ended, that this body did pass legislation a few years ago to create the ability for this data sharing to occur. What wasn't there was kind of the enforcement mechanism of this. The enforcement mechanism that I presume you're pointing to is the Cures Act, but it seems like that's still locked up in litigation. So, I'm just trying to get a sense of why we can't enforce our state law if there's a real concern here. I get the point that maybe the current cause of action is a little bit broad in a way, but are you opposed to this even if we were to tighten it up so that it was really just targeting the bill to ensure that the current law is followed, just creating that enforcement mechanism there?
So there's several issues at play with having that be the framing, and it's largely that the health information technology ecosystem, which is governed by HIPAA, which was mentioned, but that's generally what is health data information, and then the Cures Act, how all of that data is transferred from point A to point B to point C so that patients can have it wherever they are in their care journey. Now, the Cures Act goes into the weeds around how that should be done, creates exceptions for what that means when it can or cannot be shared, and creates a large policy framework, which is the how-to guide. The Maryland state law that passed 2 years ago offers none of that clarity, and several of those pieces fall in direct conflict with the exceptions that are named in the Cures Act. I would equate them very similar to safe harbors, where the way that the Cures Act is framed is there are these instances, these exceptions, when it leads to certain negative outcomes that none of which is considered in the Maryland state law. And so that's why there needs to be that additional context, the additional rule promulgation for how that road looks and for how it to be done, if that's helpful, Senator.
I mean, I guess I'm just not seeing the need to have to do that if we can simply create an enforcement mechanism here with that. I wonder if you have a letter from our Attorney General saying that we can enforce this under current Maryland law. Have you seen anything to that effect, or maybe we can request that? But I think the fact that there is seemingly no enforcement mechanism here gives me a lot of concern, and relying on, kind of the federal government statutes that are in place seems a little bit circuitous and just very difficult to be able to pursue, an enforcement piece here on a bill, or I guess law now that we have passed previously. I guess if you have a problem with the current law, I guess you mentioned that there's litigation that's going on, obviously, but that doesn't preclude us from passing a bill now to address the shortcomings that we see, right? Even if there's tangential related litigation that's going on. So, I'm a little skeptical of the fact that, we can't pass something simply because there's litigation ongoing.
2 points I'd like to address in what you shared. I think the enforcement conversation is a very reasonable one to have. I think viewing the answer to that question being civil private right of actions where companies are just litigating each other in civil court is not the enforcement that this state likely had in mind, or likely does have in mind when we talk about how to deliver the best value for patients. So I think that's really the key caveat.
So what's the enforcement mechanism you would recommend?
That, sir, is, in my opinion, is what's outlined in federal law, where there are fines up to $1 million. There are several instances given Federal law did not include civil private right of actions because it is such a complicated policy subject matter area. The intent was to have state enforcement agencies, state experts that were the ones in charge of the enforcement. There is no civil private right of action that exists anywhere else in the country. Other states were mentioned by the proponents. None of those have civil private right of actions. They are all handled by the regulatory agency that exists in those markets and oversee what data sharing requirements are in those markets.
I mean, you keep pointing to the Cures Act and the mechanism there. It just seems like that's not working currently. So I don't see the reluctance in being able to pass a state law to provide that enforcement mechanism if it's clear that the federal enforcement piece doesn't seem to be going through as intention. So clearly just a difference in opinion.
Well, I may add just one more piece, sir. If two vendors have a dispute, and that is a commercial dispute, that does not fall under the auspices of information blocking. There are several exceptions that exist, like content and manner, as an example. If I were to ask any single EHR for every single piece of data that they have unfettered access to that data, there is a reasonable area where they would be able to say, no, you don't have access to all that data. You don't get the unfettered access. So what we're talking about here is if one party doesn't get everything that they ask for, then they are creating a right of action to be able to file suit. And I don't think that that is a sustainable piece of policy, especially as it relates to health information technology and the sharing of patient data.
But this is the patient's data, and I believe that sharing has already been consented to take place. And so, this data should be available to be shared. And shouldn't just be held or blocked by a private company simply because they don't want to share that data, even though the law requires that to be shared.
And we can go through every one of the exceptions that target these areas, where if there are no security agreements between those two third-party vendors, who is then to say what appropriate and effective data sharing is? If there's no guarantee to privacy for that patient in that data sharing, just because there is a third-party vendor that has signed a contract with another third-party vendor that has signed a contract with the same skilled nursing facility, there must be agreement in how that data is transferred from point A to point B. And if that's not existing, that's an issue between two vendors. The patient's data is being seen by those that needs to see it. No clinical teams are being limited in accessing that patient data in this dialogue, in this entire conversation.
I don't know if I fully agree with that, considering I think this could impact the quality of care that a patient receives.
Senator Guile?
Thank you, Madam Chair, and thank you for your testimony. I guess I know we've talked about a little bit about this, but can you just help me understand? You mentioned the Cures Act and you mentioned that and its exceptions. Can you just elaborate on how those impact this proposed legislation?
Sure. And so at a high level, I've mentioned conversing with the senator, there were 8 exceptions that basically came to pass in 2016. Congress's intent was to encourage data sharing so that the patient's data was relatively and readily available to all care teams. However, having that unfettered access from point A to point B to point C, especially without considering these exceptions that were created, stifles innovation, creates no incentives for the further development of technology, and genuinely creates patient safety concerns. Congress created these exceptions, several of them, like I mentioned, preventing harm to patient, protecting patient privacy, security standards, content and manner. What are the rules of the road of sharing that data? That standard explicitly exists today under what's called US CDI v1, the United States Core Data Interoperability Standards, which is what we've offered to every single tech partner, tech vendor, tech entity in the entire space of how data should flow from point A to point B. And so that's just one more example of these exceptions that exist, and this piece of legislation being brought to create a private right of action. Now I'll add, Point Click Care works with over 450 third-party vendors sharing data, making sure that patients' data is in the hands of the care teams whenever they need it. This piece of legislation is occurring because a single vendor is not getting the data and the format and content that they wish it to be. And that's where this is all coming from. And I mentioned the private right of action. This language doesn't exist anywhere else because this is not viewed as a viable solution to the issue of information blocking.
You mentioned that they haven't gotten the format and the content in which they want it. They're getting it, but they're just not getting it the way they want it?
So again, when you think about what an EHR looks like, right, there are hundreds of fields that are in there that have different pieces of patient data. The federal government, under USCDI, passed the framework and the rubric for what constitutes effective and efficient patient communication. So you're not overburdening the care teams or oversharing pieces of information that exist. Things like clinical notes that are the specific notes of the doctor that uses to put that information in the EHR. The folks that are bringing this legislation want complete and unfettered access to all of the information immediately, which again conflicts with the exceptions that exist under the Cures Act.
Okay. And just one more quick question. I mean, we've mentioned CRISP a time or two during the course of this bill. I mean, I know they wouldn't take a position either way, obviously, on this legislation, but I'm just wondering if have they offered any opinion, insight, like anything that we should know?
I have never once had this conversation on this topic with CRISP, and I talk with them. I was with them this week. And so this doesn't come up. So I would be curious why that's the case and how serious this issue may actually be.
Interesting. Okay. All right. Thank you. Thank you, Madam Chair.
Thank you, Senator Mounts.
Thank you, Madam Chair. Very quickly for Mr. Holt. So Point Click Care, you are a internet. You do all the data transfer and that sort of thing, right?
We are the electronic health record. So we are the source of truth for that patient's record as it exists within the senior care center.
And the nursing home would have a contract with you?
Correct.
Right. So are you regulated by the state of Maryland as far as meeting all the requirements for the state of Maryland?
We are. So we are a active partner with the state. We work constantly with MHCC to make sure that everything is being appropriated and shared as it should be.
So the MHCC signs off and says you're certified or something like that? Is that how that works?
Well, it's a parallel track. Again, there is under ONC that's been mentioned several times, Office of the National Coordinator at the federal level. They have their standards in place for what is a certifiable electronic health record. We are one of those. And so we fall under federal law in that through that lens. So there is also a separate Maryland registry of electronic vendors, of which we are as well. So we comply with all Maryland state electronic health record laws through that.
And that's maintained by the Healthcare Commission, not the Department of Health?
MHCC, yes, sir.
Right, because we have had a heck of a time with oversight and inspection in assisted living facilities. It's been a big deal. And I'm just wondering, of these issues and situations we're talking about, I mean, could some of this be contributed to the actual facility that you're serving, not supplying or putting the information into whatever service that you're offering to that facility?
It's a reasonable question, sir. I think as it works, though, when you think about it, right, we talked about the nursing home, so this would not necessarily fall with the assisted living. But that nursing home has business associates and third-party vendors that they sign contracts with. We are just one of those. But our systems, as the steward of the health data, our job is first and foremost to make sure that that data for the patient and the nursing home is safe. And so that's what the services, one of the many services that we provide to nursing homes.
Well, my primary question was, where is the oversight? And it sounds like it's a healthcare commission. So you've answered my question. Thank you.
Thank you, Senator. I don't see any further questions. That ends the hearing on Senate Bill 678. And now we're going to hear from Senator Croza, Senate Bill 965, Public Health Women's Healthcare Data Report. And Senator Croza, you have a panel with Laura Bogley and Diane Arias.
Thank you. Thank you, Madam Chair. For the record, Senator Mary Beth Carrozza, representing Maryland's coast, and that's Worcester, Wycomico, and Somerset counties. And I do appreciate the opportunity to present Senate Bill 965, a women's health care data bill. We as policymakers depend on current, updated data to drive our policy decisions. And the state of Maryland is failing when it comes to the women's health care data front. Senate Bill 965 would require the Maryland Department of Health to collect and compile data annually regarding the cost of birth, postpartum care, pregnancy care, and abortion to better understand the financial impact of these services on individuals, providers, and the state. This legislation is intended to promote transparency and accountability in healthcare spending while safeguarding the privacy and dignity of individuals. Senate Bill 965 strikes a balance between providing transparency and accountability in healthcare while protecting privacy. If you look on the bill, it specifically states on page 3, line 23, that the department is not required to collect or report data that would violate federal or state privacy laws. And additionally, the bill states that the entities reporting to the Maryland Department of Health shall anonymize and de-identify patient data as necessary to comply with applicable laws. We want to ensure privacy, but we also want to ensure that women's health data is collected in order to promote women's health. The number of women who die giving birth in the United States has nearly doubled in the last 2 decades, and we are the only first world country with a consistently rising maternal mortality rate. As a state with a prominent African American population, we must also consider that African American women are 3 times more likely to die from pregnancy-related complications than white women in the United States. With data collection, these disparities can be identified and addressed. And what I really want to bring home to the committee, it was alarming and actually embarrassing to me to find out that we in Maryland are only one of 3 states that does not collect this information. That means 47 other states have figured out a way to compile and collect this important women's health data while still protecting privacy, but not the state of Maryland. I've also shared, Madam Chair, and with the members, it is significant that federal legislation has been introduced prior to this new administration that would mandate states to report abortion-related data as a condition for receiving Medicaid funding. It's Senate 178 is the number at the federal level. To ensure that Maryland remains compliant with federal funds and secures continued federal funding, this state-level legislation is essential for establishing proper reporting procedures and doing it on our own terms. I want to point out the benefits of having the collection of this women's health care data. It will help inform our policy decisions. So I want to make the point to the committee that the need to collect this healthcare data should go well beyond the federal pressure to collect the data to avoid losing Medicaid funding. Comprehensive data on costs for women's health and reproductive care, including pregnancy, postpartum care, birth, and abortion, allows policymakers to make informed decisions based on factual evidence. Without this data, it is challenging to evaluate the impact of healthcare programs and allocate the very limited resources we have in an effective manner, especially during Maryland's budget crisis. Collecting and reporting cost data ensures transparency in the allocation and utilization of public funds, particularly Medicaid. This is essential for evaluating how taxpayer dollars are spent and in determining if the programs are cost-effective and equitable. Another benefit for the collection of the information, identifying gaps in healthcare access. It can reveal disparities in healthcare access and affordability, particularly for underserved populations, such as low-income women and women of color. Understanding cost variations enables the state to address inequities and improve access to necessary care. Other benefits of collecting the information, cost data can highlight the financial impact of preventable complications such as untreated postpartum depression, which my goddaughter has suffered from, or pregnancy-related health issues. This allows for the development of preventive care programs, which are often more cost-effective, and they improve the long-term outcomes for both women and children. And yes, we have to have honest discussions about the accountability for abortion cost. Collecting data on Medicaid funding used for chemical and surgical abortions ensures accountability and compliance with state and federal regulations. We also, as policymakers, have I believe, an obligation to look at how we're spending money on the training programs. Data on the cost of abortion care training programs helps access the financial sustainability of these training programs. I believe this is necessary to ensure the appropriate use of resources and adherence to statutory requirements. Healthcare costs for pregnancy-related care has risen significantly in recent years. Tracking these costs provide a baseline for understanding trends and developing strategies to contain costs without compromising quality of care. Data collection helps identify areas where investments are needed to improve maternal and child health outcomes. For example, understanding the cost of postpartum mental health care can lead to targeted funding for mental health resources. Collecting state-level data enables comparisons with national benchmarks and other states. This can help Maryland evaluate how it performs relative to others and adopt best practices for improving women's health and reproductive care. Accurate and transparent data collection, I believe, fosters trust. Trust between the public, providers, and policymakers. And it demonstrates the state's commitment to responsible governance and prioritizing health and well-being of women and families. I know this committee has worked on this issue before, Madam Chair and members. I wanted to approach this in a way that the data collection would go across the board in the areas that I've discussed: birth, postpartum, and abortion. I also wanted to understand how we could do this in a cost-effective way. So I turned to former Health Secretary Dennis Schrader, and I wanted to understand what was in place. Many of you already know this, but the CRIS system, the Chesapeake Region Information System for our patients, was used as a public health utility for a platform during the opioid crisis, particularly for the prescription drug monitoring program that was required by the legislature. During COVID, CRIS became a critical tool in monitoring cases and creating reports for public health action. In your written testimony, former Maryland Health Secretary Dennis Schrader points out that CRIS can readily support public health data projects cost effectively, as Senate Bill 965 envisions. Again, you all are the experts and have dealt with these systems. My point was trying to connect this collection of the women's healthcare data in a cost-effective and infrastructure that was perhaps already in place, recognizing that there have been past bills that address this, but again, putting forward that I thought it was significant that a former health secretary went on record to say that the CRIS system could readily support public health data projects cost effectively, as Senate Bill 965 envisions. In closing, this legislation requiring the Maryland Department of Health to collect and compile data annually regarding the cost of birth, postpartum care, pregnancy care, and abortion would lead to informed policy decisions, budget transparency, identifying gaps in healthcare access, preventive healthcare strategies, accountability for abortion costs, evaluation of the training programs where we've already made an investment, and using data to identify strategies to promote maternal and child health. And that's why, for these reasons, I bring this bill to you. I ask for your kind consideration of this legislation, believing that it is an important women's health care bill that could benefit Maryland women and families. And Mr. Vice Chair, if I could, perhaps if we could hear from our witnesses before taking questions. Thank you. Thank you.
Good afternoon, Vice Chair and esteemed members of this committee. My name is Diane Adias, and I am the Associate Director for Respect Life Advocacy for the Maryland Catholic Conference, the public policy representative for the 3 archdioceses serving Maryland, which together encompass over 1 million Marylanders. We appreciate Senator Crow's leadership with this bill and respectfully urge a favorable report on Senate Bill 965. In my written testimony, I provide some extensive data, but I would like to highlight a few key points. In fiscal year 2022, the Maryland Department of Health reported that Medicaid funded 11,567 abortions and, using national data, averaged $659 per procedure, totaling approximately $7.6 million. These figures indicate that Maryland's Medicaid program has been allocating substantial funds annually for abortion services, with recent increases to enhance provider reimbursements. According to the Guttmacher Institute, which was previously mentioned, in 2023 alone, Maryland saw over 38,000 abortions, a 29% increase from previous years, including approximately 8,100 procedures performed for non-residents. In fiscal year 2025, the Moore-Miller administration allocated $5 million to increase Medicaid reimbursements for abortion care and reproductive health care services. Additionally, the Maryland Department of Health granted $10.6 million to the University of Maryland, Baltimore to oversee the state's abortion care clinical training program. The approximate average cost for prenatal care, labor and delivery, and postpartum care for Medicaid beneficiaries is $36,000. As Maryland expands services to non-residents, collecting comprehensive data is essential to access the financial impact on taxpayers and ensure responsible allocation of state resources. Maryland's total annual expenditure on women's reproductive health care is difficult to determine due to the lack of publicly available aggregated data. As a Maryland woman myself, I recognize the importance of data in shaping policy that accurately reflects our healthcare needs. Thank you for your time, and I respectfully urge a favorable report.
Good afternoon, Madam Chair is back. So good afternoon, Madam Chair, Mr. Vice Chair, members of the committee. Again, I'm Laura Bogley, Executive Director of Maryland Right to Life. That was quick. And I'd like to thank Senator Carosa for bringing this important bill, and I urge your favorable report. Unfortunately, despite Maryland's significant investments in reproductive care, we don't score well on maternal and fetal health. You know, we've got Johns Hopkins here. I think we want to be known for medical excellence. And so there's really no excuse why Maryland is not doing better or working to improve these numbers. I think we do incremental investments, in improving this. I work with HGO all the time. I know there are efforts being made there. But again, we don't really know what the spending priorities are because we're not receiving that comprehensive data. So this bill would advance reproductive health care across the state by enabling the state to accurately measure the degree to which our current public investments in reproductive care are actually serving the needs of women and their families. A complete analysis of reproductive health care data would have broad implication for women and children's health in the state. Unfortunately, Maryland does not currently prevent comprehensive data on reproductive care, as you've heard. That's partial information. Absolutely, you're aware that we don't provide or report abortion data to the CDC, as the majority of states do. So this, again, would assist state policymakers in measuring the extent to which those public investments are accomplishing our stated goals of reducing unplanned pregnancies, improving maternal labor and delivery outcomes, improving maternal health. These are all things that we say that we care about, so we need to show that with the proper investments. Since 2000, taxpayer funding for Planned Parenthood has surged by 245%. While the number of abortions at Planned Parenthood has doubled. At the same time, prenatal care has declined, with only 14% of Planned Parenthood facilities providing any form of prenatal care. So I think this would be, particularly concerning that Maryland is not examining all this data. This bill would give you the tools that you need and also allow you to budget for future expenses. So we ask for your favorable report.
Thank you. Senator Rudy, you have a question?
Thank you, Madam Chair. Senator Carrozza, thanks so much for the legislation. This bill, seems to me common sense. We always talk about the need for good data in every decision that we make, and we've, in a lot of cases, our state's collecting data on any number of metrics. Do we have any data on, we've expanded the ability for people who are not doctors to perform abortions at any stage of pregnancy. Do we have any data even about how many people have entered the workforce in those sectors, and we obviously don't have any data on how many procedures have been performed by people who are doctors versus people who are not, correct?
Thank you for the question. I think that's why in the legislation, factoring in the evaluation of the training programs would help provide that data. And I do want to go back to the fact that I don't think this Maryland General Assembly has ever shied away with the collection of information. And just to think that we are just one of 3 states that does not collect this information, that information that could actually lead to prevention in the areas that we talked about, whether it's complications with pregnancy and birth, postpartum care. So I did want to drive that point home, that I think there's a way that this committee, working with the Maryland Department of Health, again, this bill was presented in a way that it would protect all the privacy, went out of our way to make sure those protections are in place, but to collect the information so it's helpful on a number of fronts, not only for, both from the standpoint of strategies and policy making for women's health care, but also on the money, that the state money we are spending on abortion and abortion training programs, to have accountability, especially during a budget crisis, when I think that's what our constituents expect.
Thank you for that. I agree. And just in closing, last question, I like, one of the things I like about this bill is the real focus also on how we're doing as it relates to pregnancy, neonatal care, after, postpartum care. I had a bill last year that we weren't able to get through, dealing with trying to make it so that we have, so that we have for pregnancy, for live births, that there's more help for costs for people who are not who are like above the Medicaid level, but are not the super wealthy type folks that get help with some of those costs for live births. And I think we want to continue to emphasize and do everything we can to make birth and make childbirth and the aftermath of childbirth following that to be really as healthy as we can. Can you? I don't know. Anybody can answer this, but we're not doing well on infant mortality, which is surprising to me as a state, considering the investments we make, particularly at the Medicaid level. So I don't know if you could.
So I think the numbers that Ms. Bogley just presented, the disconnect of the investments, where we are seeing we're not seeing the outcomes we want, but you also look at compared to the investment that we're making.
And we're not collecting any of that data either, are we?
No, we are not.
Yeah, that's problematic. Okay, thank you. Thank you, Madam Chair.
Senator Mounts.
Thank you, Madam Chair. With this legislation, is there any, as far as collecting data, is there any distinction on the data for in-state versus out-of-state services provided? So, we just had a bill hearing on public health abortion grant program, and there was testimony supporting the bill, talking about the lack of resources, lack of funds, and in fact, that out-of-state pressure was the draining the resources. And so one of the questions I was asking is, well, what is the do you know the in-state versus out-of-state? And the answer was actually one of the groups it's identified in the testimony opposing this bill, but I don't know of any breakdown of that. And I mean, is that, do you think that should be included in the bill? And then do you think that would be helpful in identifying kind of what's happening in this area of healthcare?
Again, a part of this, we talk about the accountability of state funds. And right now, there is no collection of that information, so therefore, there's no differentiation between residents and non-residents. I believe that there would be a way, again, of being very sensitive to the privacy issues, but again, the fact that we have, I guess, a world-class system, with CRISP, or how to do it in a way that protects the privacy, but I believe our constituents would want to know how much of the state funds could be going to non-residents.
So, Senator, you are very aware we share a county, and when you cross that county line, you go into an economic boom when you leave our state and go into that state. I mean, wouldn't you see the value in knowing that, well, if we're in economic hardship in the neighboring state, I mean, just driving Route 13 north, don't you think it would be helpful for us to know if while we're doing that, maybe perhaps if the numbers reflect we're providing health care, for the citizens of that other state? I mean, it's a pretty dire situation on our border with Delaware.
I think it's necessary that we collect that type of information, and it comes back to policymakers that can then influence future policy decisions.
Thank you.
Thank you. My Vice Chair.
Thank you, Madam Chair, and good afternoon, Senator Cardoza, and thank you for bringing this bill to us. There's several organizations that have expressed an unfavorable report on this, including the Maryland Network Against Domestic Violence, the Women's Law Center, the MedChi, which represented a lot of our doctors, as well as there's other organizations. But looking at the MedChi testimony, they identified, I know you said that this information isn't collected, but in their testimony, not only do they point out the hardship that it would place on some of our medical providers, but it also points out that this information is already provided by the Guttmacher Institute and the Society of Family Planning. And in their testimony, they say that this information is more accurate. I'm not sure if you was aware that this information was already published, or what's the difference in the information that's already provided versus what you're requesting?
Yeah, I'll let my witnesses go into a little bit more detail, but the bottom line is we as the state of Maryland, as the department, as a state, we don't have that collection of information. And again, as I said, I think it was just startling to me that to be one of 3 states to not have that that information. But while I understand that there's been collection in other areas, it doesn't have the comprehensive approach that we're taking with birth, postpartum care, pregnancy care, and abortion. Can you add to that?
Yes, thank you, Senator. The Guttmacher Institution is a pro-abortion organization, and they provide estimates for Maryland and the 2 other states that failed to report abortion data to the CDC. So the last report I saw, they said that we had, they estimated that about 30,000 abortions occur here. We believe it's almost twice that. But the only information that the state reports to us year over year is the Medicaid funding. So that is, abortionists that want to seek reimbursement for the abortions they commit. And in that case, they're perfectly capable of reporting their abortion data without, impeding on their patient's privacy when they want to get paid back. So that's the only information the state collects, is that Medicaid reimbursement to abortionists. And I think, as Diane said, that's about 13,000 abortions they report for Medicaid abortions, which is, I think, about 9.7 million a year. But we know that the state probably invests much more in abortion to abortion providers, promotion, and organizations, more around 33 million a year.
No, thank you for sharing that. Not only did the MedCai submit testimony stating that the information was already available, the Women's Law Center did the same in their analysis, that the information in the health survey information is more accurate. But what they also said was the potential of this being intimidating to patients. It literally says patients' fear about the confidentiality of reproductive health services are very real and merited, as abortion opponents have publicized confidential and highly personal information about recipients of reproductive health care on websites and to the press. And they go on to talk about how it produces a hostile environment for those patients. Is there any concern that this may be intimidating to some of the patients that you hope to?
So, Mr. Vice Chair, I guess I have enough confidence in this committee that if there's a way to do this and to ensure both all the way around the privacy and to ensure that there would not be that impact. And I want to go back to just to address some of the opponents seem to be focusing on the collection of the abortion data, as I understand it. We, as a state, in all these other areas, again, I was trying with this bill to have at the state level a comprehensive approach cutting across birth, postpartum care, pregnancy care, and abortion. So I was really trying, my intention was, if we, and again, knowing that there, is a system at the state level, that we have this information, that we would be able to then make some, when we make policy decisions about maybe focusing more on prenatal or postpartum related to mental health, that we would actually have the information at the state level. And yes, there is, I also believe in the abortion accountability as well, because these are state taxpayer dollars. So I had confidence and still have confidence that this committee would be able to navigate how you can have a more robust women's healthcare data collection and protect the privacy and knowing what systems are in place to do that.
Thank you for your responses. Thank you, Madam Chair.
Thank you. I don't see any further questions for this panel. Thank you for your testimony.
Thank you very much.
That ends the hearing on Senate Bill 965, and our last bill of the day is Senate Bill 985, and Senator Washington is here, and it's Consumer Protection Third-Party Litigation Financing.
Surprise, surprise. Good afternoon, Madam Chair, members of the committee. For the record, Senator Alonzo Washington here to present on Senate Bill 985, which seeks to regulate the actions of third-party litigation financing groups regarding litigation financing contracts. This bill enshrines in law the right of all Marylanders to make decisions regarding the conduct of their court cases, no matter who is responsible for funding them. It imposes a fiduciary duty on these types of financing firms in some class action circumstances, and establishes a framework for penalizing these financing. It's called TPLF, so I'm gonna use those. It's called third-party litigation financing, so TPLF groups that engage in usury. This bill also mandates 10 simple disclosures, which will protect Marylanders from predatory agreements. Most important among these disclosures are an explanation of consumers' rights under Maryland law and an explanation of the total amount the consumer will have to repay if their litigation is successful. Third-party litigation financing has enabled plaintiffs who would struggle to fund litigation under normal circumstances to pursue their claims in court. However, third-party litigation financing firms have used their leverage over plaintiffs to exercise control over litigation and disguise the terms of the contracts from the consumers. On top of that, these financing firms, providers, have sought to maximize their profits by charging exorbitant interest rates, collecting their fees before the plaintiff sees any single penny, and attempting to collect even when litigation fails. All of these practices are unfair and should be outlawed under SB 985. There are currently no federal regulations to ensure transparency or protect consumers from unreasonable contracts. As a result, Marylanders who make the use of third-party litigation financing are forced to navigate opaque contracts that frequently place the interests of the third-party litigation financing provider above the interests of their customers. This bill enforces transparency and fair pricing on an industry that is sorely in need of it, and make sure that any Marylander who signs this type of contract understands exactly what it is they are signing and how much it will cost them. Placing a cap on the interest rates of these providers and these contracts is a simple but effective way to make sure that Maryland consumers are not being taken advantage of by contracts that charge interest rates, which makes credit card debt look quaint. And I'm sure we understand that. The bill mandates that disclosures be written in big, bold font and ensures that these providers cannot bury these disclosures to hide them from the consumer's view. By mandating disclosures to consumers and opposing counsel, these providers will lose the veil of secrecy they have operated under for the last decade, making our legal system a fairer and more transparent one. Imposing a fiduciary responsibility on these providers engaged in class action lawsuits is the most effective way to ensure that their primary concern is for the benefit of the plaintiff. Anything less than a direct and legally binding concern for the plaintiff's financial well-being does not go far enough to protect class action plaintiffs from abuse by these providers. Because there's no law regulating these types of contracts, it is important to ensure that Marylanders are just as protected as citizens of any other state would be. Passing this legislation means that Maryland is just as willing to step up to the plate to protect its consumers as are the 10 states that have already taken action on these types of contracts. For these reasons, Madam Chair and Mr. Vice Chair, I urge a favorable committee report on Senate bill. Thank you.
Thank you, Senator.
Great bill, great bill.
D. Robert Enton, would you like to go next?
Thank you. Madam Chairman, members of the committee, Robert Enton on behalf of the American Property Casualty Insurance Association. You have our written testimony, and we are in very, very strong support of this bill. You know, it's interesting. I got a copy of the sign-ups. When you look at the sign-up sheet for this bill, what you'll see is it's supported by the American Property Casualty Insurance, by the Maryland Employers for Civil Justice Reform Coalition, by the National Insurance Crime Bureau, by State Farm, by the Maryland Attorney General's Office Consumer Protection Division, Bryson Popham on behalf of NAMIC, the American Tort Reform Association, and the Maryland Chamber of Commerce. It's an unusual coalition of supporters for a piece of legislation. But it is a pro-consumer, pro-business piece of legislation. And what you're going to hear from the other side, from the trade association for these companies, is, oh no, this is not a loan. Well, I don't see how anybody on this committee who deals with lending issues all the time would think it's not a loan. The Commissioner of Financial Regulation thinks it's a loan. The Office of the Attorney General thinks it's a loan, and we think it's a loan. They give you the money, and you pay it back out of the proceeds of the whatever happens in the litigation. Now, they'll say, well, it's not a loan because it's not recourse. They don't have to pay us back if they don't get money out of the litigation. Well, the state of Utah has this law, and according to them, in 97.9% of the cases that are funded by these companies, there's a recovery and they get paid. This is a loan. We think it's a loan. Your regulator thinks it's a loan. All the industry groups, the Chamber of Commerce, and everyone else thinks it's a loan. It is a loan, and it needs to be subject to regulation like any other consumer loan. We want them to be licensed. We want them to have rates of cap on their rates. If you look at what the information from Utah, and I'll provide this to the committee, says the rate of return of these agreements was between 105% and 300%, with a median return of 137% and a mean return of 153%. They need to be subject to the same caps and regulations as everyone else who makes a loan to a consumer in the state of Maryland. I urge the committee to give the bill a favorable report, and I'm happy to answer any questions. And thank you, Senator Washington, for sponsoring the bill.
Great bill.
Thank you.
Good afternoon.
Nancy, I don't see you on the list, but you must have signed up. Usually you're virtual.
Yeah, I did sign up and I submitted the written testimony. Is it part of the package?
Okay.
All right, thank you. My apologies. And Chair Beidel and members of the Senate Finance Committee, my name is Nancy Egan with the American Property Casualty Insurance Association. I want to thank Senator Washington for introducing this consumer protection legislation. Senate Bill 985 just puts into statute the current practice of the Office of Financial Reg. This industry has been put on notice since 2009 when they issued the first consent order against Oasis, and that is included in my written testimony. These are small loans made to plaintiffs involved in cases advancing their money until the case is settled, and then they take the amount due out of the proceeds. The opponents are going to say they are not loans, but that is not what the current practice of the state of Maryland is. There is some amendment language that the Office of Financial Reg is in my testimony, making sure that the licensing information is added to the bill. And the Consumer Protection Division is also asking for some cross-referenced language, and we're waiting on their amendments. The testimony of the Consumer Protection Division makes it clear, and I quote from their testimony, TPLF providers market themselves as access to justice with little or no risk to the consumer since their lending services are contingents, are non-recourse. Consumers only repay providers if there's recovery in litigation. Any argument that these loans should be treated differently than other small loans because they are contingent on a successful recovery in litigation is not strong, as the Maryland Consumer Lending Law explicitly covers loans under $25,000, even if they purport to be contingent. While it is unclear what TPLF lenders typically charge for their loans, as it appears to be a guarded secret in the industry, the Consumer Protection Division believes disclosure of the interest rates and other costs on lending is important for transparency, as this bill purports to create. We ask you to give this bill a favorable report, and I have some examples of some cases that the Office of Financial Reg has taken against these lenders in the past several years as well. Thank you.
Thank you, Nancy. Are you Mark?
Yes, Madam Chairman. Thank you for allowing me to testify today. My name is Mark Behrens. I'm also here on behalf of APCIA, and I consider myself more of a subject matter expert, so I'm happy to mostly be here to answer questions of the committee. I just want to highlight a couple of things because there's a lot in here, as you can see, on consumer protection. Having clear contracts that spell out the terms, tell consumers exactly what they're getting into, how much it's going to cost them, and a right of cancellation. So if they decide, because a lot of times when people are involved in a lawsuit, they're at a vulnerable time in their life. And so this gives them the right to cancellation and pay the money back if they decide later this is not something that I want to do. There's a provision in here dealing with class actions. You all have probably been in a class action at some point in your life and probably didn't know about it. You get these cases where sometimes you get a notice in the mail that says, you were part of a class action lawsuit that you didn't even know about, and you're going to get a coupon to go buy the product that you just allegedly claim was defective, but now you're going to go get a coupon to go buy a new one. And what happens in those cases is that the lawyers, sometimes people call these lawyers class actions because the lawyers get together and then the issue could be that you get a funder that's really working with a lawyer to promote a case where they both benefit and the consumer doesn't get much out of that. And this bill would require the lender in those cases to have a fiduciary duty, so they put the interest of the consumer first ahead of their own financial self-interest as a lender. And the other thing that I think is very important in this bill is the disclosure provision. What the bill says is that the funding agreement should be disclosed to the parties in the litigation. And it's the same corollary on the flip side that is part of the Maryland court rules, that when somebody brings a personal injury lawsuit, let's say after an automobile accident, the defendant is obligated to produce the insurance agreement. And that's there so that the parties can reach a settlement. And here too, this would facilitate settlements if there was disclosure of the funding agreements similar to insurance agreement disclosure on the defense side. And with that, I'd be happy to answer any questions the committee may have.
Thank you. Senator Mounts.
Thank you, Madam Chair. And I've got a couple questions for Mr. Enton. The other states, are they how are they treating these are they treating the transactions as loans? And have any of the other states, not Maryland, particularly in this area, have any enacted legislation dealing with these transactions?
Ms. Egan, I think, has more familiar with those instances than I, but I think that a number of states have passed this legislation. It's pending in a number of states, and in a number of states, it's treated exactly this way, including the state of Utah.
Who would have the best information?
I do. Yes,
thanks.
if you don't mind,
Please.
I can provide an answer. In 3 states, the Colorado Supreme Court held that these are equivalent to making loans. The South Carolina Department of Consumer Affairs issued a ruling that these entities funding litigation are subject to the South Carolina lending laws. And we just got a copy of an OASIS consent order out of Connecticut saying that they are subject to the consumer lending laws in that state. 16 states have regulatory oversight of these bills. 5 states require disclosure. 3 states require disclosure of the consumer agreement and the commercial agreement, and the other states provide for discovery of these agreements, the other 2. And then there's registration and licensing in 1, 2, 3, 4, 5, 6. I think it's 9 states. And then there's caps in several states. You'll see Arkansas has a cap of 17% plus other caps on what they can charge for documentation fees, because there's all these fees that are included. Nevada caps it at 40%, Tennessee at 25%. West Virginia also has a cap. So there is regulation across the states. In Maryland, the current law is for the first $1,000, they can charge an interest rate of 33%, and anything above $1,000, they can charge 24% on these types of loans.
And that kind of feeds my next question is how would you quantify the rates? You said there's caps, so 25%, 17%. Those are caps. Without a cap, how would you quantify the rate for these transactions? I'm not sure who the best witness would be to respond to that.
In the states that are not regulated, there isn't a cap. So they can charge whatever the consumer will agree to.
So with the nature of the transaction, could you guesstimate what that is?
I think, for example, there was let me give you a case that was, excuse me one second. The 9/11 first responders, and this is where they were already guaranteed they were going to get money out of the fund. Okay, so this is up in New York. A severely disabled 9/11 responder was charged an annualized interest rate exceeding 250%, even as he was guaranteed money from the 9/11 Victim Compensation Fund. On a $35,000 advance, he paid a financier $63,636. then that was only on a 3-month loan.
And so, and the way that works, and so refresh my memory, so I know we have a cap in Maryland. What is that cap?
That's 33% on the first 1,000 and 24% for anything above that.
That's the rate of interest on
The rate of
on a
interest.
consumer loan.
Now, I don't know if there's how they regulate fees in the other states, because they can charge additional fees besides just the interest rate.
And is this, what is this? Is this legislation capping?
This is just putting in law
It would
the current
apply to-
practice of the Office of Financial Reg has issued cease and consent orders in 3 separate occasions, and it was just enforcing the fact that these type of lenders need to be licensed here in the state if they want to operate, and they have to be subject to our laws about consumer lending, which is that 33% and 24%.
And in some of the opposition testimony, I won't lose my place. I'm going to read this is one of the comments, and I'd be interested in your response to it. And it asserts that as drafted, this legislation confuses litigation financing with consumer legal funding. It applies that the funds that are being provided to the consumer are used to finance the litigation, and that's a justification for the opposition. So the argument is that it's confusing, the bill is somehow confusing litigation financing with consumer legal funding. Can you address that topic?
Let me try to address that. I've done a lot of research on this, and there are commercial loans and class action lawsuits that get made, and sometimes investors invest in those loans. I have a copy right here of an agreement, a litigation funding agreement. They don't call it a loan agreement, they call it a funding agreement. And this was, I found this online, and they advance money, and they say that the investment return, so it's, they characterize it as an investment, not a loan. The investment return, it says that subject only to the fees due the lawyers, but prior to the payment of any other amounts from the litigation proceeds, litigant, that's the plaintiff, shall cause the lawyers to pay funder all amounts owed by litigant to the funder pursuant to section 4.2, that's what they advanced, if any, plus an amount without reduction, set off, or counterclaim equal to the actual funding plus the greater of 50% of the remaining litigation proceeds, 50%, up to 3 times the actual funding or 30% of the remaining litigation proceeds. So this is an agreement between BioCardia, Inc. and a funder. So that's the commercial side. But on the consumer side, according once again to Utah, which requires that it be reported, the rates of interest for these exact same agreements in Utah, the interest rates, they say, as I quoted before, are between, the return is between 105% and 300% on these agreements.
Thank you. Thank you.
Senator Lamb.
Thank you, Madam Chair. Wanted to ask, I think Ms. Renton was touching on this here at the end. So currently, are these litigation financing contracts disclosed? Are we able to get access to them? Or
No.
I'm seeing head shaking. You can't.
No.
No.
So you can't even.
Not.
So we don't even know what the term. People can't see what the terms are.
Right, and Senator, Madam Chairman, that's one of the issues why disclosure is needed, because, as a lawyer who litigates cases from time to time, when you go to settle the case, you need to know that you're talking to the person with authority to settle, rather than think, okay, we're going to reach an agreement, and then to find out that they've got to go make a call to see if they have either the authority to do this, or it can complicate settlement depending on, what the rate of return for the consumer is going to be. Because obviously, it can complicate settlement because the consumer is going to now need to pay the lender, right? And so you've got
some of these cases where you have the attorney taking a 40% contingency fee, if the attorney's firm has received funding itself, they might be paying an outrageous amount. There was a case in Philadelphia I wrote about this week in the Cornell, in a journal at Cornell, where a plaintiff in Philadelphia settled a workplace injury lawsuit for $475,000. And when he got the itemized expenses from his law firm, they deducted $137,000, which was a loan for $81,000, compounded interest came to $137,000, which was a 70% return. So that came out of his recovery. So he's got the attorney's 40%. He was charged off another, basically a quarter of his total money went to that. And then the consumer would also have to pay off the funder. At the end of the day, there may not be a whole lot left to the consumer. And it's very important for the defense side to know that, to settle the case. And that's why disclosure, I think, will be important to help protect the rights of consumers. When these disclosures are out in the open, you'll have more transparency and less potential for a consumer to be gouged by a bad actor, and it also would facilitate settlements of private lawsuits.
Right, so the consumer in some of these instances wouldn't even know what these terms were.
Right, in the Philadelphia case, that was a commercial lawsuit lender where the firm, he sued the plaintiff's firm and said, I never signed up for that. Nobody told me that I was going to be charged, a huge percentage of my recovery because the lawyer decided to get funding. That's separate from the consumer lawsuit lending, obviously, but it all goes into the mix when they go to settle the case, because you have all these people that have that put their hand in the hat to take their funding out. At the end of the day, there may not be a lot left for the consumer.
Could the lack of disclosure of these agreements lead to potential ethical issues along those lines, or?
Senator, it can, particularly on the commercial funding side, because it's in that situation, it's more likely that the funder may exert control over the lawyer and about settlement. In fact, there was a professor, Maya Steinitz, who's written a lot about this, that was on 60 Minutes a year ago. And she told Leslie Stahl that on the commercial side of litigation funding, that it's transforming the civil justice system, that the funders are now deciding which cases get brought, how they're litigated, when they settle, and how much they settle.
Okay. And does it seem like this problem is growing? Is it, are we seeing the trend of these types of instances occurring more and more? I mean, what's the general trend direction?
Yes, it's interesting that you asked that, because in the state of Utah, where they have this law, I think going back to maybe 2021, and they track the number of filings, the number of filings for the entities that make these loans has just gone up dramatically. It continues to grow. If you Google this online, and then you will clearly see the websites for these companies, and how consumers can respond. And it's interesting. Oasis was the company that was kicked out of the state of Maryland back in 2009, and they just got kicked out and settled with the with the banking commissioner in the state of Connecticut, paid a fine and agreed to remit fees to Connecticut consumers. So it is, and this consent order was entered into on January 17th of this year. So this is a growing problem across the country, and it's not just big business, it's consumers too. And what I find fascinating is that what you'll hear is, oh, this money is for groceries, whatever. This money is money that goes to the consumer. There's no limitation on what they can do with the money.
Last question. I'm just looking at some of the testimony in the bill folder here, and I think some of the opposition will contend that without third-party financing, for example, that these individuals would be unable to sustain lengthy legal battles compelling them to go into settlements that don't actually reflect the final value of their claim, their actual value of their claims. What's your response to that?
We're not trying to stop the practice of the lending to the lawsuits. We're trying to have that disclosed. On the consumer side, we're trying to put guardrails to protect the consumers of Maryland and just really put into statute what is already the current practice in the state of Maryland of the Office of Financial Reg, which is making sure that these contracts are much more disclosure to the consumer and to make sure that it's clear that they're subject to licensing. So we only asking for disclosure of the fact that these exist. We're not asking on the commercial side to do anything more.
Right.
And I see there's
Senator,
a
you
supportive
have
letter
the-
from the AG's.
Yeah, you have the written testimony from the Attorney General of the state of Maryland, your Attorney General. And Mr. Sakamoto Wengel is here. And it's not very often he and I are on the same side, but today we are. And you can see exactly what the Attorney General says.
All right. I see you love that letter.
Thank you, Senator. I don't see any other questions for this panel. Thank you
Thank
very
you.
much.
Thank you.
We have Marta Hardig favorable with amendment.
Thank you, Madam Chair, Marta Harding, on behalf of State Farm. I apologize. I thought I signed up for this bill. Obviously, I did sign up for the bill because you just called me. But when I checked the signups this morning, I wasn't signed up, so I came woefully unprepared. I didn't bring my file. But I can be very brief. I do know what our amendment is. We support the bill. We agree all the consumer protections and the disclosures in the bill are very, very important. What we would just ask the committee to consider is putting an overall cap on the amount that can be recovered from the award of 25%. This is what they did in Montana, so that notwithstanding, even if interest rate and everything else complies, at the end of the day, you can't get more than 25% of the award. And again, that's something they did in the state of Montana, and we think that that likewise protects consumers in the end. So for those reasons, we support the bill.
Thank you, Marta. And you may have come unprepared, but I see that your written testimony is here with your amendment and rating, so
Great.
thank you.
And then, of course, Nancy wasn't signed up, and she definitely signed up, so.
Oh, she
maybe-
says she signed up. She
Yeah,
just wasn't
I'm
there.
not sure what happened with this bill, but it all worked out.
It's almost over.
Thank you.
Thank you. And now we have two unfavorables, Eric Schuler and Chris, say your last name, Chris?
Figueres.
Chris
Just
Figueres,
ignore
thank
the
you.
"you," that helps.
Pardon me?
If you ignore the "you," that helps.
Thank you, Madam Chair. My name is Eric Schul. I'm the president for the Alliance for Responsible Consumer Legal Funding, and we're the trade association that represents the companies that offer the consumer legal funding product. I feel like I'm the devil incarnate here by the previous testimony here. Just want to clarify a few things. We do not, and I want to repeat this, do not oppose regulation. I welcome regulation. And in fact, probably about 85% of the bill I like, and in fact, I would like to add stuff to it to make it even stronger for consumer protections. The problem is the bill is drafted, puts us out of business, and it prevents this product from being offered. You know, it was stated that, you know, wonderful pieces of legislation passed in Arkansas, West Virginia, and Montana. We don't operate there because of those pieces of legislation. Was also addressed was the report from the state of Utah. I do welcome you to go look at that report, but look at every single year that report has been offered and not just the first year. Yes, the first year the numbers are skyrocketing, and I tell this to people all the time, because these are cases that settle short. These are cases that settle in the first year. If you look at the latest report, you'll see 40% of the cases that our companies were involved with settled for less than contracted amount. And you will also see the rates that are offered there drop dramatically in it. So if you look at that, please, I welcome you to look at the entire report and not just one of them. Want to make it clear, too, the product that we offer to consumers does not fund the litigation. It does not pay for court costs, expenses, things like that. All it does is pay for household needs and making sure people have a roof over their head and the food on the table. My time is short. One of the quick things I want to say regarding the case in New York dealing with RD legal funding, that case right there went to the courts, and the court said that these are not loans because the outcome is undefined. And every single statute that we have passed, it is not considered a loan. And in fact, most of the states have passed, when they have passed legislation on this, specifically state that this product is not a loan. And I welcome your questions.
Madam Chair. Madam Chair, Mr. Vice Chair, members of the committee, my name is Chris Figueres. I'm here on behalf of the Maryland Association for Justice. I appreciate the opportunity to speak on this bill. So the stated intent of this bill, Senate Bill 985, is to promote consumer protection through regulation and disclosure. So among those disclosure requirements, the 14-point bold font, the terms cannot be amended without full disclosure of what is the total amount to be paid, is the requirement that needs to provide to each of the other parties in the civil action and each insurer any litigation financing contract. I'm here to talk only about as the bill applies to litigation funding. These are the requirements to make these same contract terms known to the person that harmed you. This bill is related to civil action, so these are cases where one person harmed another and a civil claim ensues. In order to bring your claim, perhaps your attorney needs to engage funding to hire multiple experts. Now you're an injured Marylander, and now you must disclose those terms to, say, the engine manufacturer who defectively manufactured an engine in a helicopter that crashed and just killed your husband. Or maybe to disclose to a bar owner that cut away a second-floor deck railing to get a pool table in and then negligently patched it, causing you to fall 20 feet, causing your paralysis. Why do those that harm you and their insurance carriers have a mandatory right to review these terms? This is not consumer protection. This undermines a consumer, an injured Marylander's ability to pursue a valid claim. It violates their privacy. It provides strategic advantages to a well-funded defendant. And it's also unnecessary because judges already have the authority to review these contracts if needed. So for these reasons and for those that are in our written statement as well, we would request an unfavorable report on this bill. Thank you, Madam Chair.
Thank you. Do I have questions? Senator Reed?
Quickly, I'm not quite sure where I am on this bill totally. I do think there need to be certainly some additional guidelines, but you just mentioned, how, why do you get the right, why does the defendant get the right to review this? Doesn't the plaintiff have the right to review? Don't you generally get the right if you're being sued, or if you're the one who's suing, you get the right to review what insurance that person has, correct?
Sure.
So that you know what your lawyer, your attorney knows what you're dealing with, like what kind of settlement could you get, so why wouldn't it be okay to know the other way? I'm just curious.
Right.
I get your other argument. I mean, I'll try to process it, but
Sure.
why is that not okay
Sure.
to have the same?
I hear the question. So I would say that those are apples and oranges, would be my answer to you. So in a defendant's contract for insurance, those would be what is available to pay the claim, not what is providing perhaps some funding. Perhaps maybe in different cases, the law firm is providing the funding to bring in an expert that with the plaintiff having the burden of proof, the plaintiff needs to present the claim, right?
Right.
And to present that claim to make the argument of how a person is injured and how it relates, right? Because that's an important piece of the puzzle. Experts need to be brought in to investigate and then potentially to write reports, testify at trial, all of those things that are expensive.
Well, right. Now, oftentimes a law firm will incur those
Right.
costs,
Right.
but in some cases, someone may have a different arrangement.
Right, exactly.
Why
So
is
in
it
a
not
different
fair
case, a different
to-
firm might have a different arrangement, exactly. So,
But
right,
why is that not
so-
fair? Why is it not fair for me if I've all of a sudden been sued and I'm
Right.
out of the blue and and you've pointed out some excellent examples of terrible things that happen, but there's also people who get sued that it's a lot more murky as to whether they're at fault or whatever. I mean, why should I not know if the person suing me has other financial backing that might make it more advantageous for me to settle? Am I asking that right?
That would make it more advantageous for a defendant. It wouldn't be more or less advantageous whether a law firm has secured funding for cases. I mean, I hear what the proponents
yeah, it
were
would,
saying
because
about,
if I might know how long the defendant, I'm getting the plaintiff mixed up here, but I might know, wouldn't it be advantageous for me or my lawyer to know how far they're willing to take it?
well, why is that the defendant's decision to make when they've harmed the plaintiff? The plaintiff should be
Well,
able to bring
allegedly
their
they've harmed the plaintiff. We haven't had the trial yet.
Of course. Right, but that's part of the case, right? That's part of bringing the claim. That's part of presenting it to the jury, to the judge, whoever is the trier of fact in this case. And if the trier of fact, the judge believes that something like that is getting in the way of the merits of the case, the judge already has the authority to review that and consider that if the judge believes it's problematic.
Okay, yeah, I see the concern with the other parts of the bill to some extent. I see both sides of this bill. I'm trying to work through it, but I'm just curious about that. Okay, thank you very much. Thank you, Madam Chair.
Thank you. Do I have any other questions for this panel? Senator Kramer.
Thank you, Madam Chair. Is it Mr. Schuler?
Schuler, yes.
Yes. So, Mr. Schuler, you indicated that there's much of this bill that you think is appropriate and you would support, but there's a portion of it that, and if I understood correctly, you said it as drafted would put you out of business. Is that
correct?
Would you be able to share with the committee those areas of the legislation that you feel, and I don't want to get, hopefully as briefly as possible, because it's late in the day, but what in particular is it that's in this legislation that, as proposed, that you believe would adversely impact your ability to stay in business?
Thank you, Senator. If you look at my written testimony, I have put an amendment in my written testimony that clarifies everything. I spent 23 years in the Army, and I had a commanding general one time tell me, don't bring me a problem unless you've got a solution. So I kind of go by that philosophy. And if you look at our written testimony, and I'm happy to go over with you, but one of the main things in here is that the restrictions under the current loan statute make it cost prohibitive for us to offer the product. I can tell you right now,
You mean caps on?
the caps on it. But what we want to make sure about, and what we're offering in here, is that each contract will have what basically I call a will not exceed number. So the consumer and their attorney will know day one what is the cost of this product. The other thing too, which is interesting of this particular financial product versus any other financial product, in order for a consumer to get this, their attorney has to review the transaction. Their attorney has to sign off on it. If their attorney doesn't sign off on it, it doesn't happen. Just to get $500 from any one of our companies, an attorney has to review that contract, go over the terms and conditions with the consumer, and say, yes, this is okay for you to do. We've worked with APCI.
Is that true of everybody in your industry?
Yes,
Or
and
that's just a policy of?
No, it's everybody who belongs to our association. It's part of our set of best practices, which we worked with the American Bar Association on. So anybody who belongs to our association has to follow that, and we put that in every single statute that we pass. And in fact, we worked with APCIA in Iowa this year on Senate File 54. That's an agreed-to bill we worked on with them. It clearly defines what is consumer legal funding, and it clearly defines what is litigation financing.
So if you're talking about a will not exceed provision, how would that differ from a cap? Give me some.
Each company
and
will.
I'll be honest with you, I'm coming from a consumer perspective on this. So I'm trying to figure out, okay, what is, fair and legitimate, and what may be an industry taking advantage of a consumer. So that's the perspective I'm coming from, just so.
No, and I appreciate that. By putting a will not exceed number in there, the consumer and their attorney will know what the maximum obligation is of this. Each company is going to impose their own cap. And to me, that's a fair market situation. If one company wants to charge one rate, another company wants to charge another rate, they're going to be clearly disclosed on that contract. They can go from company A to company B and see it. If they don't like that number, don't sign the contract,
Will that
renegotiate it.
be in a percentage or in a fixed dollar?
Fixed dollar.
Fixed dollar.
And I want to also make it clear, we do not take a percentage of the cases. That we are prohibited from doing that. That's an issue called champerty. And then you can also get into a situation where there'd be potential fee splitting. So we do not, every single one of our contracts is a set dollar amount.
And what else is that the extent of the concerns, the heartburn you have is the?
No, and then also to the other issue of the automatic disclosure. What we agreed upon in SF 54 in Iowa and in other states with the insurers is basically a tiered system, which we passed 2 years ago now in Indiana, which is if requested, the consumer and their attorney within 30 days will acknowledge, yes, my client has one of these. And then it follows the norm.
Sorry, repeat that the
will
client has what?
acknowledge that my client has one of these. The consumer and their attorney will acknowledge, yes, there is a consumer legal funding contract on this case. Second, then it follows the normal course of discovery, meaning you have to go in front of a judge, show cause as to why you need more information about this particular contract, the terms, conditions of it, things like that. But finally, in the end, it's inadmissible against the consumer. So you can't go into court and say, by the way, if you award Mrs. Jones this award here, you're not giving her the money. You're giving this company in New York City. They're the ones who's going to really profit from it, not Mrs. Jones. And we've agreed to that in Indiana, and we've agreed to that in SF 54 in other states as well.
Okay, and that's the extent of what you think?
That's the highlights of it. But like I said, it's all in my testimony. In the written testimony, we put a copy of the proposed amendment that we would like to see.
Okay. Thank you for that. Thank you, Madam
Appreciate
Chair.
it.
Senator Reedy.
Thank you, Madam Chair. Second bite at the apple, but a different witness. So can I ask, going on to the amount of money that you receive, and it's a fixed dollar amount.
Correct.
That's good. Are there some operators that get an astronomical sum? And I know the answer, first answer to the question could be people can negotiate on their own, and I generally agree with that. I generally agree with buyer beware, but there can be deceptive practices. Is there times where if you win $10,000, I get 5,000 of it, or if you win $50,000, I get 25,000 of it, or is it more like you get 10%? I mean, how does that work?
Well, I mean, each contract is different, but that's why proper regulation and basically having will not exceed number is important. And so the consumer and their attorney will know this going into it. So there is no ifs, ands, or buts about it. What I've heard in the past from the insurance industry is that they go into these negotiations with their consumer's attorney. And the consumer's attorney says, okay, I think we can get this. It goes back to the consumer, back to their client, and the client says, oh, all of a sudden, well, I've got this from ABC Funding Company, and that's not enough money. I need you to go back for more. That's why in all the statutes we've passed, except for one, Indiana, it requires their consumer and their attorney to acknowledge the transaction, so the consumer's attorney knows about these right from the get-go.
Okay, so that the attorney.
Correct. The consumer's attorney, the plaintiff's attorney,
yeah, right,
knows about these transactions right from the start, so there is nothing hidden. So the consumer's attorney knows about these right from the get-go. So there is nothing.
And can craft a strategy based on.
And can craft a strategy right from the start. There's nothing hidden. I don't want anything hidden from consumers.
Do you have an objection to the idea? It was the debate I just had with, or not debate, but the discussion I just had with with the MHA representative. Do you have heartburn with the defense knowing these arrangements?
Let me just be honest. Am I thrilled about it? No. Because to me, this is a financial tool. It'd be just like filing a complaint and then attaching your bank statement to it. Okay. Because this is the financial tool that the consumer is using to get to where they need.
Okay. All right. Thank you.
Any other questions for this panel? Nope, I don't see any. Thank you very much. Thank you. That ends the hearing on Senate Bill 965. We're going to give Tammy just a couple minutes to set us up for voting, and we'll be back in a few minutes to vote. Thank you.